validity holds that there should be a good fit between research designs and what is being studied. Briefly, to give you a sense of how we're approaching this project, this is the analytic matrix we've developed for our scoping review. As you can see, we want to understand what research methods may fit with a wide range of different types of traditional medicine, each of which have their own characteristics. We're also considering a wide range of different research designs, including clinical and basic science, social science, and policy research. Of course, it's also critical to consider the local contexts where research is being conducted. For our mixed methods systematic review, the second phase of our study, we will be looking at different types of barriers and enablers to conducting traditional medicine research across different communities, countries, and regions. These include things like financial issues or political conditions, training availability, cultural factors, including the fact that some communities may have lost trust in researchers. We'll want to learn more about how to improve the quality of traditional medicine research and research synthesis, and how to translate this into policy. Across our review, we'll be engaging knowledge users like yourselves in various ways. We have a project review team that includes experts from all global regions. We will also be holding focus groups and creating working groups to engage stakeholders from different communities. Finally, we've created an online consultation portal where people can provide their input on the issues we are studying. You can access the portal using the QR code or a web link above. There, you can share documents and citations and tell us about barriers and enablers to traditional medicine research. Please do visit the portal so you can contribute to the review findings. And I encourage you again to visit our exhibit here at the summit, where you may learn more about the project. Thank you so much.
Thanks to Nadine for a great introduction and some great work and showing some of the issues we face moving forward with the methodology required for this. Also giving us the word of the day, epistemologic. So I hope you're all going to try and drop that into your coffee break conversation at least once and see if you get a prize for it. So we'll move back on to our live panel at the moment, and our next speaker is S.R. Narahari, and S.R. is the director of the Institute of Applied Dermatology here in India. And a slight change of tact here, where he'll be talking about the introduction of an evidence-based integrative medicine approach for filariasis. Thank you.
Okay, I'm talking about the levels of evidence available for introducing integrative medicine as a public health intervention for familial lymphedema. As we all know, lymphedema is a global problem. Although lymphatic filariasis, which causes lymphedema, transmitted by mosquitoes, caused by parasitic worms, is a neglected tropical disease. So that is, WHO estimates about 36 million people are affected worldwide. In 2004, we developed, under the mentorship of Professor Terence Rayon, Oxford Dermatology, an integrated medicine protocol which combined Ayurveda, yoga, and biomedicine at the point of care. And therefore, it was clinician-led and patient-centered. We published a community trial in Royal Society Journal. These are the components. You can see in the middle how the limb changes in 2 weeks' time. So the components include the initial nurse-led counseling, where nurse gives all the information about the disease, and health-related quality of life is also taken. And then a skin wash is given. Subsequently, a Fanta soaking solution is, limb is dipped into the Fanta soaking solution, which is made up of different Ayurvedic formulations. Then the bacterial entry points are treated with the Ayurvedic herbal powders. Ulcers are treated with the Ayurvedic oils. Pains go into the yoga later, and then a very good oil massage of about 20 minutes is given. I must say here that all these Ayurveda formulations selected based on Vata, Pitta, and Kapha. And then they go into compression bandage, and that's the result you can see in 2 weeks' time. So, but for biliary lymphedema, there are no very effective treatments available world over. So the WHO says to consider any treatment for biliary lymphedema, it should improve the quality of life, it should reduce the volume, it should reduce the cellulitis, that is biliary fever, and disability reduction. So the WHO New Delhi office commissioned a clinical audit of our patients. 1,698 patients followed up from 2010 to 2009. We did a clinical audit. And the frequency of cellulitis reduced to 0 at first and only 5% in the second follow-up. And these are the triggers or what are called risk factors for cellulitis. These are all 7 are there, like intertrigo, folliculitis, all those things do not have very effective treatments in allopathy or biomedicine. And you can see how the patients improve over first and second follow-up after the discharge. Most importantly, their quality of life improves from the baseline 73% to the follow-up 92%. Most importantly, they are able to go back to their work. This mostly neglected tropical disease affects the poor, so they are unable to work because of the disease, and they are able to go back to their work. Very significant reduction we see is in the volume. The volume is, you can see the volume. At discharge, we see about 25% of reduction with the confidence in 95% CI there. First follow-up, we see further reduction to 1.4 to 2.7%, and second follow-up, further reduction to 1.26 to 3.34%. You can see this patient in 2009, she came at the end of second follow-up, dropped the follow-up, comes back after 12 years, maintaining the same response. That means self-care integrative medicine is sustainable and family member assisted, and therefore it is doable at home. So now we are able to scale it up into 4 centers in 4 Ayurveda medical colleges, 2 in UP and 2 in Bihar. Thanks to Bill and Melinda Gates Foundation, we are able to do it. And there is a response. Patients, all the clinics are already overwhelmed by the patients. Thank you very much.
Thanks, SR, for a terrific example of integrative care. So for our final speaker, I think we'd all agree that there's no topic hotter than artificial intelligence in the world today. We can't pick the newspaper up without reading. While we hear a lot about the dangers of this, of course, there's huge potential for good as well in AI. And Meni Snene, who's at the IDAR, the International Digital Health and AI Research Collaborative in Geneva, is going to talk to us a little bit about the use of AI to assist mapping of evidence for traditional medicine. Thanks, Snene.
Thank you so much, and thank you for this nice invitation to present our work. This is an ongoing project in partnership with WHO, and it's about finding the place of the AI in the traditional medicine. And when we first were tasked with exploring AI and its potential in finding evidence from traditional medicine, my thoughts journeyed back to my time in Tunisia. As a child, whenever I fell prey to cough, my grandparents would come to rescue with their traditional remedy. Although this was part of our heritage, it was galaxies away from what we today can say as a scientific proven remedy. Many of such traditional remedies passed down through generations and might indeed hold kernels of truth waiting to be validated by rigors of modern science. But there's a big challenge. These gems can be buried deep within countless tales and traditions, making it a hard task to filter through and locate which one truly serve and could be a science-based spotlight to be discovered. This is the crossroad where AI comes in as an assistant to tool with its ability to deep dive into vast pools of unstructured data and semi-structured data coming from real-world data. It can help identify potential practices that show promise, steering them towards further scientific validation. AI, with its ability in natural language processing and machine learning, can examine this vast reservoir, transforming it into a more structured data and research-friendly format. The structured data, when combined, creates comprehensive data panorama that can seamlessly assist traditional medicine with scientific evidence-based practices. The result that we expect is that an enriched real-world data that offers a panoramic view of patient healthcare outcomes, transcending the limitation of unstructured data sources that we have today. Finally, through AI's computational power, we can accelerate the discovery and seen patterns, hidden links, hypotheses, and association. In our journey to harness the potential of traditional medicine and AI, our foundation lies in meticulous data collection. We have dived into a multitude of platforms. It's not working. Okay. Into a multitude of platforms ranging from well-curated research papers to a diverse set of real-world data, which included patents, clinical trial registries, gray literature, and patient-reported outcomes. To traverse this extensive information, we have implemented advanced natural language processing techniques, specifically a name identity extraction model. That model has proven proficient at pinpointing intricate causal links between different entities. After establishing these relationship between and links between different entities inside of our unstructured data, we have consolidated the data, making it a little bit more structured by using specific scoring systems. We have not only refined our methods, but also expanded to scope to ensure global relevance by making our model multilingual and multi-topics. I need to press. To ensure that our vision is both scientifically anchored and replicable, it was imperative that we first build an ontological foundation for traditional medicine. This foundational step provides a structured roadmap to navigate the flow of data and the information by constructing this ontology. And we are essentially creating a blueprint that clarifies the details of various traditional medicine practices that could be included. This includes aspects such as the social determinant of use, the scientifically identified evidence, anthropological origins, mode of administrations, and the various stage of care. Then we extracted taxonomy of evidence, which served to harmonize terminology from both semantic and syntactic perspective. This allowed us to comprehend how patients articulated their experience and facilitated the extraction of evidence from their narratives. It becomes our Rosetta Stone, aiding in understanding how an individual from India might describe their Ayurveda benefits, or how someone from South America elaborated on the benefit of specific leaves. With this framework established, we integrated several AI techniques. Through natural language processing, we extended our search into vast data sources, pinpointing and extracting these patterns and significant instances. Finally, we mapped the instances onto a knowledge graph. It acts as our compass, unveiling the vast web of connections within traditional medicine, directing our AI to uncover hidden patterns and relationships. Although our project demonstrated promising early results, effectively processing vast amount of unstructured data and highlighting existing causalities, however, we soon encountered several limitations. And one of these essential limitations is that although there is an ample research on integrating AI into classical medicine, our venture into the convergence of AI and traditional medicine is really pioneering. A critical component we identified as missing was the traditional medicine large language model. A large language model is a machine learning model designed towards understanding and generating human-like text based on vast amount of data it has been trained on. It can also analyze and interpret vast amount of unstructured data, transforming it into meaningful insights, and structured knowledge. Traditional medicine, with its vast reservoir of practices and knowledge, necessitates a bespoke large language model to encapsulate its depths. Crafting dedicated traditional medicine large language model will not only amplify the accuracy of AI-driven evidence mapping, but also establishes a new foundational pieces that paves the way for AI research advances in AI. Thank you for listening.
Thank you, Mehdi, and a great way to end. We're talking about some of the oldest forms of intervention of medicine, but the fact that some of the most modern techniques can be the way we actually start to look at the complexities in a different way, and we really should think outside the box in the way that we address these large multi-component kind of trials. So thanks to the speakers for really doing a good job on time. It gives us around 15 to 20 minutes open for questions from the floor. I've been asked to kind of move across the room so we don't exhaust the people with the microphones. So perhaps I can take a couple of questions from the left, then I'll move to center, then I'll move to right. So perhaps the lady in white on the left there, I saw your hand go up. If you can address it, if it's in general to the panel, that's fine. But if it's to one of the specific speakers, please do ask and we can let them answer.
Sure, thank you. First of all, I would like to say that it was a wonderful talk and wonderful session. Thank you all speakers. My name is Santoshi Narayanan, and I practice integrative oncology at University of Texas, MD Anderson Cancer Center, US. I enjoyed the presentation from the standpoint of how do we take the systematic review to the next step. For example, right now with Society of Integrative Oncology at MD Anderson and ASCO, American Society of Clinical Oncology, we are working on guideline development so that the gap between the conventional practitioners and traditional practitioners can be narrowed. However, when it comes to systematic reviews, one of the challenges that we see is, for example, I recently did a systematic review and published on medicinal mushrooms and cancer. Many of the studies are region-based. For example, China, Japan, and Korea, that's where most of the studies come from. So my question to the speakers is that, how do we interpret these studies at a global level? And the second question is, how do we all here envision taking the guideline development, which is currently based on the countries, to a global level? For example, we have NCCN guidelines, ASCO SIO guidelines, which applies to American population. Is that applicable to other countries? Do we have enough studies? And if we don't have enough studies, how do we build these studies? How do we conduct studies? So there are so many questions, and if you could address that, that would be very helpful. Thank you.
Thanks. Anybody want to take the first one on systematic reviews? Either Suzanne or please. I see Miang Su keen to go.
Yeah. Thank you for your great question. Regarding to clinical practice guideline, it's very complicated. It includes the contextual, cultural context in translating to one country to another country. And it depends on the clinical question and the member of the clinical practice guideline development, and they decide what to do. And in the case of Korea, we search all the Chinese, English, and other countries' database, not only for Korean, because clinical practice guideline developed in Korean medicine does not mean it applies to only Korean. And we try to find out all the evidence around the world. And we also, in the process of clinical practice guideline, there will be the therapy course process. It means you can discuss internally and which one you take and or delete from in your clinical practice guideline.
Okay, thank you. So
yes, there are issues. I think people are biologically the same, whether they're in China or the US or elsewhere, but culturally they're different. And in terms of their medical treatment, that can also be quite different. So for example, last year we published a systematic review of PSK for the side effects of colon cancer treatment. And most of the trials were from Japan, but they were also about 20 years old. And so treatment of colon cancer is now different from what it was 20 years ago in Japan and in the US. So we really couldn't say anything useful about the PSK. So that's an example where it's time more than culture, but there are also examples of culture. So yes, it is quite complex, and if we had a system where we identified a gap from a systematic review and then we were able to efficiently carry out trials to fill those gaps and answer our questions, I think we'd be much better off. And this is one of the limitations I didn't really have time to go into, but I do think that's a problem with our evidence generation, is that we can see these gaps. But it's much more difficult to fill them in an efficient and targeted way.
No, thank you. And quickly, I want to comment on the development of guidelines, which is something that on the global guidelines, WHO has sort of a big history on developing. And I think that we need to be strategic when we talk about traditional medicine, because the first thing to do is to try to disentangle what is generalizable and what is quite specific to one individual, to a certain context. And I think that if we start by looking at the things, if we look at the mapping that Myung-Soo, the one that we have done with Capsin, for instance, across the board, the evidence, are there generalizable interventions? Okay, then we can start by there. Because otherwise, we always receive this pushback that is on traditional medicine is very specific to one individual and a certain context. But we have seen, for instance, with the example of artemisinin, that there are things that can be really for a global effect. That's my first comment on this. Thank you.
Thanks, JP. Let's move to the center block. I see the gentleman at the front here.
I'm Ricardo Gelman. I'm the chair of the Brazilian Academic Consortium, the Capsin, and to be provocative, thinking about the opportunity of that landscape of global perspective, how can we propose to connect all groups that are doing the same maps in different institutions in one same platform? Because there is an overlap of study. We are working in similar methodology, but could be one possibility. I think this is one, just would like to hear from you and compare what's the difference between the methods. Thank you.
Thanks. Why don't we take first to JP, then Myung-Soo. I'm using the time-honored method that if I see the panel nodding their heads as the question's coming, they're getting put on the spot
Yes.
where they're answering it.
No, thank you, and I will try to be very quickly on this. Just before the session, we were having this exactly conversation with Myung-Soo and also with some WHO colleagues that we need really from the next few weeks and months to try to coordinate and try to agree in terms of what is the methodology that we are going to use and try to not duplicate and join efforts. I think we are, as I said in my talk, we are in a wonderful moment, and the inception of the Global Center can really be provide us with leadership to continue in this path. Thank you.
Yeah. We can talk later. Is it okay? Yeah. Thank you.
So my question is for Mehdi and also to Mr. Lee. As you are mostly researching and looking at the data that's coming from the Korean ecosystem, and Mehdi is actually working creating an AI model on traditional medicine, which would include probably all the global system medicines, including Ayurveda. How do you see, Mr. Mehdi, that both of these are coordinating and you are able to create a model which includes all the major system medicines? And if there are any outcomes that you see that, for example, if there are outcomes from Ayurveda that, for example, Koryo can use, or for example, for that matter, even Sowa Rigpa can use, how do you see that? So maybe both of you can answer on that.
One of my slides explain about that. We try to include all traditional medicine around the world and categorize it into some specific intervention, like herbal remedy, and we try to more widely, not to the specifically inside.
Yeah, there's already some internal coordination between our colleagues and some systematic review work and the AI work on keywords and specialities that we are integrating inside of our model. I will not pretend that we are including all traditional medicine specialities at all. We are simply focusing on, at the early beginning, this is a project ongoing on herbal medicine, Ayurveda, and which offers a very nice cornerstone of building these kind of AI models, because we have a very scientific foundational aspects behind it. The idea is to move quickly from the AI model to a large language models, which will encapsulate several other traditional medicine specialities, and that's why we are building this ontology to set up a foundational piece to design and to understand exactly what we should classify as traditional medicine or not.
Thanks. I see the person who's been very patient just in front of you here, then I'll move to the block on the right. Thanks.
Thank you very much. Thank you, everyone. My name is Kevin Chang. I'm the founder of Kai Analytics. We're a Canadian data science company specializing in NLP as well. So I really enjoyed your talk there. A lot of your graphs resonate with me, and really excited about the work you're doing. I have one comment and I have a question. My comment about the evidence gap map is I use them a lot for my work too. I think they're a great way to tag and gather data. But with traditional medicine, from my experience, patients actually see multiple methodologies. If they see Ayurveda, they might see an ND. And I think one of the limitations with an evidence gap map is you're not able to see the association rules. Ironically, it's a little bit siloed. And sometimes if there's a gap there, it might not be a real gap. It's just not applicable to that methodology. So it might be something to consider. In terms of my question is, I wonder, you've collected such robust data, 240,000 observation points there, and each with different categories. You're building a model on that as well. One of the things is I'm wondering, how do you encourage more private and public partnership in these type of research? For example, I have a great team, but some of these data that the WHO publishes, they're just high level. We're not able to access some of the raw data. And I partner with a lot of universities that are eager to kind of work with these models, and I think there's a lot of opportunities to kind of collaborate more. And I was wondering, what venues are there right now for more private-public collaboration? Thank you.
Thanks. Maybe we should start with Myangsu, and then JP, did you nod your head on that? Maybe just nod your head a lot, and I'm going to pick on you.
Yes, this data it may be available in the web if there is no copyright issue, and the method is similar, and I think it depends on the question. It's like the systematic review, and you can see it will be uploaded in WHO after some process, and you can access all the data, and it will be helpful. Yeah.
My comment is very minor. I think that integrating the different sources of evidence, we still need to refine a bit further the methodology to bring all these different types and traditions of evidence together. And just want to note that particularly on Ayurveda, with Cabeçin in Brazil, there is an ongoing work, a map going on with 32 identified systematic reviews specifically on Ayurveda. Yeah, thank you.
Thanks. Okay, we'll consider you as part of that block, and possibly the last question coming on here before I round up. Thank you.
I'm Mitali Mukherjee from Indian Institute of Technology in Jodhpur. I wanted to ask you a question regarding your ontology. How are you bridging the ontologies of different knowledge systems? So do you use a framework like the human phenotype ontology to be able to connect and make it interoperable? How is it that you're bridging ontologies?
So from a technical perspective, we are using OWL, so that's the implementation process. How we end up with the ontology, this is undergoing work that need to be validated. It's not yet at that stage, and it's the early draft that we have shown. The design was done in a recursive manner. We started from extraction of keywords and taxonomy, building high-level representation of this taxonomy, getting the building blocks inside of the taxonomy, what are the constituents of the taxonomy, and then going back to the keywords to see if all or major descriptions of the elements that we have extracted fit within the different blocks. So we have done some spiral refinements, starting from text, ending with a design, till we have a proof model that could contain major elements of what we consider a traditional medicine description.
Okay, thank you.
Great, thanks. I'm going to take the chair's prerogative in the last 2.5 minutes to bring in somebody we haven't heard from, and that's SR, as a practitioner who's using this. So perhaps your reflections out to the audience. We're talking here about mapping what we know and how do we learn more. What do you need to know? What is your experience? What would your take home to this audience be?
As a practitioner, I would say that we need to get more training. People who are interested in integrated medicine need to training on the traditional medicine. We need to work with traditional medical practitioners. We need to understand what this science is. So reading is very important. And then allopathy structures need to be imported to structure the data, the clinical science. Essentially, it's the clinical science which is traditional medicine is. So allopathy is also clinical science. Let us look at the clinical evidence rather than looking at the molecular evidence. Structure the clinical evidence using allopathic models, merge it with Ayurvedic or any traditional medicine. This is how we have won.
Thanks very much. And you bring me in with 30 seconds to spare on our part of the session. First, a notice, and I am told that the plenary will start at 4 p.m. in here. Yep. And my last and very pleasurable duty is ask you all to thank the fantastic panelists for sharing their experience with us. Thank you, and enjoy the rest of the discussion.
I remember feeling really afraid 2 years ago when I was gasping for breath, feeling like, I didn't know what was happening to my body and I was no longer in control. I consulted lots of allopaths, the family doctor, specialists, they ran a whole bunch of tests. They said that I was allergic, probably to dust, but that it couldn't be fixed. And so I decided to consult a homeopath. He told me to start yoga. I had to incorporate exercises for my lungs within everyday regular activities. I have young kids, so he said, blow a balloons every day that'll help strengthen your lungs. And with homeopathy, it's mind plus body. So you're playing a more active role. You're observing, you're making changes, you're reporting back, you're checking in. And particularly pranayam in yoga. And to make sure that it's something I did every day, not just to strengthen my lungs, but also to de-stress. This entire journey with traditional medicine has made me realize that there is a very strong connection between our mind and body. You have a role to play in your own health. You can make choices that impact how your body reacts or responds or heals. A lot of it is in your hands, and I love that.
The most stressful part of what I do as an athlete is that first round jump when I'm at the top of the runway. Being based in the UK, being born and bred in Manchester, I have certainly been brought up with a very conventional mindset around medicine and healthcare. I'd literally had 2 years of incessant injury, 2 surgeries within the space of basically 12 months. And I'd had enough. I really wanted to seek out healing, and that healing wasn't just a physical healing, it definitely was an emotional, spiritual, mental healing. Some of the important practices that I do personally to focus on staying healthy would be making sure that I go out and do my meditative walks in the woods or in the forest, even in the park nearby to my home. I think it's important that we realise that conventional and traditional medicine can go hand in hand. You can't keep giving, going hard 100% of the time, because ultimately you're going to burn out. I have this rhythm of rest, recovery, performance, rest, recover, performance that is part of my day, my week, my month, my year.
What has been for centuries the integral source of health for people and communities? What is still the first port of call for millions of people worldwide for their health and well-being? Its traditional, ancestral, and indigenous knowledges of health and the world around us, constantly evolving, in balance with self, in harmony with nature. But how can we harness its potential to help us address the health challenges of our busy lives? To turn the promise of health for all into a reality for all. To deliver people-centered health services that are respectful of cultures and traditions. By sharing our knowledge and experiences of traditional practices, we can understand, acknowledge, and advance its role in building a fairer, safer, and healthier future. Respecting the wisdom passed down from generations and embracing science, technology, and innovative thinking. Blending traditional and conventional, underpinned by robust evidence, innovation, new technologies, and sustainability. Imagine if we combine the best of the modern and the best of the ancient to harm with health, societies, and nature. It can be done. Together, we can embrace the potential of traditional medicine and create a healthier, more sustainable, and balanced world. What has been for centuries the integral source of health for people and communities was still the first port of people worldwide for their health and well-being. Its traditional, ancestral, and indigenous knowledges of health and the world around us, constantly evolving, in balance with self, in harmony with nature. But how can we harness its potential to help us address the health challenges of our busy lives? To turn the promise of health for all into a reality for all. To deliver people-centered health services that are respectful of cultures and traditions. By sharing our knowledge and experiences of traditional practices, we can understand, acknowledge, and advance its role in building a fairer, safer, and healthier future. Respecting the wisdom passed down from generations and embracing science, technology, and innovative thinking. Blending traditional and conventional, underpinned by robust evidence, innovation, new technologies, and sustainability. Imagine if we combine the best of the modern and the best of the ancient to support harmony with self, societies, and nature. It can be done. Together, we can embrace the potential of traditional medicine and create a healthier, more sustainable, and balanced world. What has been for centuries the integral source of health for people and communities? What is still the first port of call for millions of people worldwide for their health and well-being? Its traditional, ancestral, and indigenous knowledges of health and the world around us, constantly evolving, in balance with self, in harmony with nature. But how can we harness its potential to help us address the health challenges of our busy lives? To turn the promise of health for all into a reality for all. To deliver people-centered health services that are respectful of cultures and traditions. By sharing our knowledge and experiences of traditional practices, we can understand, acknowledge, and advance its role in building a fairer, safer, and healthier future. Respecting the wisdom passed down from generations and embracing science, technology, and innovative thinking. Blending traditional and conventional, underpinned by robust evidence, innovation, new technologies, and sustainability. Imagine if we combine the best of the modern and the best of the ancient to support harmony with self, societies, and nature. It can be done. Together, we can embrace the potential of traditional medicine and create a healthier, more sustainable, and balanced world.
Our culture and our land are in our bones and in our blood.
Traditional medicine holds great potential. Let's recognise that these are our inheritances for our future generations.
We are part of the solution, one that will benefit all human and planetary health.
It's very hard to be healthy on a land that's screaming out for help. Humanity cannot be well when we're not caring for what looks after us, and that's our planet Earth.
For Indigenous peoples globally, our concepts of health are holistic. Our health is also dependent on the health of our family, our community, and our land. So much so that it cannot be separated.
We kind of lost the connection we had with nature and with different ways to approach health. It's not like you have to choose medicine over natural ways of approaching health.
I think it's important that we redress the balance so that it's not all one thing or the other, but actually that we can find a beautiful middle ground.
Medicine comes from a culture, from a geography, from a place, from a people, from a need, from a climate.
Traditional medicine matter to the people of Africa because this is our culture, this is our future.
I think it's important that we realise that conventional and traditional medicine can go hand in hand.
Today there's more reliance on Western medicine, and what we do need to have a really strong forward-looking, progressive way of being able to recognise the medicines of millennia.
Que no se pierdan esos saberes propios, nuestros, que son tan sagrados, que son tan nuestros, que es la esencia de la vida del ser mismo, de estar conectados con la diversidad de pueblos, con la diversidad de nuestras semillas, con la diversidad de nuestras plantas, con la diversidad de nuestras aves.
Yoga is basically an ancient Indian practice. Yoga brings out the positivity from within, it improves our mental well-being, and it brings out the overall well-being of an individual.
TCIH is about more than just medicines. We need research on professions and practices more than just products.
We as Indigenous peoples know that our intimate and intricate understandings of our lands and our medicines have so much to offer everyone.
It's now time to recognise the opportunity that we have. It's time to turn on our ears, open our eyes, open our hearts, and understand where we need to go to together, collectively.
This is move it from.
Yeah, back and forth. Easy.
Check. On, okay. Okay. For those of you who are already in the room, could you please be seated so that we can proceed with our plenary session as quickly as possible, as we are already behind time considerably. Yeah. Good afternoon, distinguished delegates, ladies and gentlemen. Welcome to the second plenary session of the WHO Traditional Medicine Global Summit on Country Data and Global Evidence. My name is Anjali Jutaputhi, and I will be your moderator of this session, which will take about 75 minutes. The objective of this plenary session is to provide the global status of the progress of traditional medicine via situation analysis and the WHO global survey and country data provided by member states, with insights on regional trends and glimpses of best traditional medicine practices that selected countries and WHO regions have integrated into the health system. We have here, as you see, 10 speakers and representatives from 4 WHO regions to give intervention in our session. Therefore, to keep our session within 75 minutes, kindly hold your question until the end of the session. And to start the session, I would like to invite the audience to participate in the guess the statistics quiz, answering 4 selected multiple choice questions on the global status of traditional medicine using your mobile phone. And I'd like you to turn on your app, WHO event app, go to the page on Global Summit. In there, you would see the poll and Q&A. Poll and Q&A, you just tap on that. And then in hall 4, there will be polling. So you go in there. Wait. Don't give the answer. Please. Please. Uh-oh. Just give the questions. Uh-oh. Please. The team that should be the question and then let people answer before giving the solution. Yeah. Uh-oh. I mean, people already answered? Oh, okay. Then, the first question is, how many member states have a national traditional medicine program? This, I would say that, as you know, that the WHO has published the WHO Global Report on Traditional and Complementary Medicine in 2019. So the information that we would like to ask from you is based on the survey conducted in 2012 with the supplement on 2018. So the first question is, how many member states have a national traditional medicine program? And many of you answer A, right? A, 48%. So give the hand to yourself. This is a correct answer. Yeah. Then we move to the second questions. How many? Oh, I see. You have to, this one. Hey. No. This is the second question. Okay. Second question is, how many member states have a national traditional medicine office? How many have? Majority answer 56 member states have, 61%. Okay. More on 75, 25%, and okay, 98, 10%, and 107 is only 10%. Okay. The answer, the answer is actually 107. So the least of you answer correctly. You know? So quite considerable number of member states have the National Traditional Medicine Office, which is officially mandated in carry on anything in charge of traditional medicine issues. So any country that have the office would usually move fast. Question number 3. How many member states have a national policy on traditional medicine? Nobody answered. 98? Oh, okay, okay. Have a national policies mean it's the role that government in the development of traditional and complementary medicine in healthcare systems. You have objective and goal. So majority answer 75, 98 member states, 32%, 124, 17%, 19%, and last one, 170 is 8%. Which one is the correct answer? 98. So 31% of you answer it correctly. 98. 98% would account for 51%. So about more than half of the member states already now have the policy on traditional medicine. Do you know how many member states WHO have? 194. So if you like a ballpark, like half is 87. Then if you want to know whether it's more than half or lower than half, then 87 is the half number. So it's 98%, which 35% can answer correctly. Now we come to the last part. In what year did WHO establish the traditional medicine program? 1976, 1985, 1992, 2002, or 2014? Okay, still voting, still voting. Okay, most of you answer 1992, 44%. 21%, 1976. Okay, increasing now. Yeah, okay. 1985 is 15%. So which one is the correct answer? 1976, yeah. We have started the traditional medicine program in the WHO for quite a long time, 47 years, 47 years. And we have come a long way, no? 47 years. And I think when we start the traditional medicine strategy, the next one, it would be about half a century, 50 years. It would be about that. And we have come so far, but still we have a lot of things to do in the future, right? Many, many things to do that we gather together to try to bring the policies into practice. Okay, thank you very much for your enthusiastic engagement in this quiz activity. So Next agenda, we are honored to have the Secretary of the Government of India, Department of Health Research, and Director General of Indian Council for Medical Research to deliver a keynote address on designing integrative research for national health systems to generate both clinical and preclinical data and evidence using initiative like transdisciplinary approach to generate, to investigate the health benefit of both conventional and traditional medicine in India. So, ladies and gentlemen, please welcome Dr. Rajiv Bahal.
Thank you very much, and a very good afternoon. So I'm going to be a little bit of an outlier, as I'm not going to present the global data or the country data, but rather I'm going to share with you a new joint initiative in India that we have started on integrative health research between the Ministry of Ayush, which is our traditional medicine, and the Ministry of Health and Family Welfare, Department of Health Research, ICMR. So what do I mean by integrative health research? So we, in our country, we already have modern medicine or conventional medicine, whatever you may want to call it. We already have a council for medical research that I head for working for more than 110 years. It was established in 1911. We also have, for several years now, an established Ayush Council, and several councils, in fact, an Ayurveda Council and other councils for traditional medicine research. So when we are talking about integrative healthcare, what we are talking about is a transdisciplinary, holistic approach on where we want to combine the benefits of modern medicine and traditional medicine to improve the quality of care and quality of life of patients. And this is the intersection that I'm going to talk about. So we, as I said, in the past few months after I joined with Secretary to the Government of India for Ayush Ministry, we formed a strategic partnership and signed a memorandum of understanding in which we had several strategic decisions made. One was to have a chapter on integrative health research within the National Health Research Policy. So we have included that chapter now, and this National Health Research Policy is ready for release. But more importantly, we jointly decided to develop and fund an initiative to generate evidence starting from clinical trials. And I'll just say for 1 minute why we decided on this, because it was also mentioned in the previous session that when you work with traditional medicine, it is hard to have the same principles of saying, I want to know the exact molecular active agent that I am going to test. So we decided that we are going to start from the other end. We are going to start with clinical research on important leads that we know from our experience and observational evidence that might work, and actually generate rigorous evidence on that. And if it works, then we will go backwards and try to find the mechanistic ways or the mechanisms by which those integrated medical care would work or health care would work. We also decided to do that. We are going to establish centers for advanced integrative health research, starting from the premier medical institutions in India. Those are called the All India Institutes of Medical Sciences. Now we have several of them. There was one in New Delhi that was expanded to 6, and now it has been expanded to 22. We are going to start with the well-established 6 aims in order to give impetus and interest and motivation to medical researchers to include research on integrative healthcare. The third issue was to also think about enabling ecosystem for conducting integrative health research. I'm going to talk one slide each on one of those issues, and on joint research methods capacity strengthening, because we also felt, and it was a felt need of our traditional medicine colleagues, that they would like more capacity on research methods, and as well we would like to develop methods for this integrative research further. So in terms of evidence generation through clinical trials, as I had mentioned briefly, what we did was to jointly identify promising leads for high priority conditions, health conditions, based on systematic reviews of literature. So we looked at all kinds of not only trials, but all literature that was published, and picked up those things which we thought would be most beneficial when combined with modern medicine, when we could combine traditional medicine and modern medicine. And those, for each one of them, we have designed large multi-center clinical trials to evaluate safety and efficacy using the most robust and rigorous methods. So these are all double-blind, individually randomized controlled trials, wherever possible. Where blinding is not possible, there will be randomized controlled trials still conducted with the best possible, most rigorous methods possible. The trials will be implemented at selected clinical, we have a clinical studies and trials unit and ICMR, which has a network of more than 40 institutions in the country. So they will be the places to conduct the studies, but these will be jointly funded, jointly monitored by both Ayush and ICMR, and data analysis, interpretation, and dissemination of findings will be done jointly. And for example, I've given two examples of studies that have already been initiated. One is on treatment of anemia, and one is on osteoarthritis. These two are particularly difficult problems in India, where modern medicine has really struggled over the past maybe 30, 40 years and has not made much change. Just to speak a little bit about this ICMR, Ayush ICMR Centers for Advanced Integrative Health Research, as I said, these are the All India Institutes of Medical Sciences. The aim is that they would generate robust evidence from not only clinical trials, but also the mechanisms, the basic research, the relationships, the omics of different, using the most modern approaches possible to also study and also conduct implementation research once we find something is efficacious. And they will also work towards adapting research methods for integrative health research. So in about creating an enabling ecosystem, we did an analysis of the gaps and the difficulties that were faced by researchers who wanted to do integrative health research. And we found, first thing we said is, if it is supported by at the highest level between the Ministry of Health and Family Welfare, of which we are one of the two departments, as well as the Ministry of Ayush, that would give confidence to people. Very important to have high-level buy-in. Our Honorable Health Minister and the Minister of Ayush both blessed this, this initiative. Adaptations in research, bioethics in particular, they were found to be one of the difficulties when these studies were being assessed by ethics committees that did not have any traditional medicine experts. So since the Department of Health Research has all the bioethics are registered, bodies are registered with us, and we do the guidelines. So we have made guidelines for integrative health research where it is mandatory to have experts of both modern medicine and traditional medicine in ethics committees when they discuss integrative health care research projects. Similarly, There are issues with a regulatory framework in terms of getting approvals, and that we are working with the Drug Controller General of India's office. And lastly and importantly, adequate funding support for research, which again, as I said, we have decided to support not only the big research projects that I talked about and the research centers, but also other funding initiatives. So in terms of research capacity strengthening, as I said, was a felt need. We already have several basic research methods online courses of ICMR, National Institute of Epidemiology, which are mandatory for all medical college faculty and postgraduates. And we've decided to extend these to the Ayush faculty and postgraduates if they want to become more adept at research methodology. In addition, we have decided to have two types of workshops: clinical and epidemiological research methods, where it will be all joint workshops, where the Ayush Ministry will nominate selected researchers, and we will conduct multiple such workshops over a period of, let's say, each workshop lasting 2 weeks, on similar lines as the research training methodology workshops that WHO used to have. Advanced integrative health research methods. So we will be working and developing these to say what are the issues and how do you conduct in the best possible way integrative research, which will be, as I said, jointly developed, and then we will train other researchers on both the Ayush side as well as the medical side. So the way forward is to accelerate this integrative health research agenda nationwide. We are starting with the premier institutes, but that's not where we want to stop. We want to encourage a lot of other institutions, medical institutions, to also conduct integrative health research. We want to use these research findings to update guidelines for clinical practice and public health programs in India. And finally, extend this integrative health research to newer areas such as artificial intelligence, precision medicine, etc. So that was just to share our experience and what we are, a journey that we've just started. Maybe in a couple of years, we will be able to give you more insight into the results. So thank you very much.
Thank you very much, Dr. Rajiv Bahal, for your insights on the integrative health research to develop evidence to support the integrative use of both conventional and traditional medicine for people's health. This initiative is really interesting indeed, and it's really commendable. Next in our session, we'll have 3 speakers who will talk to us about the activities that WHO and member states conducted and is currently underway to obtain information on the current situation of traditional and complementary medicine in the WHO regions and in the world, to assess the results of the implementation of the current WHO traditional medicine strategy. First, we will hear about the results of the studies undertaken by the Ministry of Health Malaysia for the WHO, analyzing the status and situation of traditional and complementary medicine in primary health care for the Southeast Asian region and the Western Pacific regions of the WHO. Originally, it was planned that the Director General of Health, Ministry of Health Malaysia, Dr. Muhammad Razzi bin Abu Hassan, will present this work to us. But unfortunately, he could not be with us today. So today we have Dr. Goh Cheng Sun, Director of Traditional and Complementary Medicine Division, Ministry of Health Malaysia, to deliver this study on behalf of Dr. Razzi. Dr. Goh, please.
Thank you, Dr. Anchari, for your kind introductions. So, ladies and gentlemen, a very good afternoon. First and foremost, I am here speaking on behalf of my superior, Director General, Dr. Razid. So, because he's not able to attend this global summit, he would like to tender his apologies. Because due to the ad hoc method, he needs to attend immediately. So that is the reason he requests me to deliver this presentation, these important presentations to every one of you. So, ladies and gentlemen, in fact, this is a situational analysis of the traditional and complementary medicines in primary healthcare in Southeast Asia and Western Pacific regions. TNCM divisions in a capacity as a WHO collaborating center in traditional, complementary, and integrative medicine work together with WHOs to do this survey. So in fact, how you say, this is the outline of my presentations. So this analysis is to assess the current landscape of TNCM in primary healthcare, identify challenges, and document the best practices in the selected member states in the Southeast Asia as well as the Western Pacific regions. In fact, we have selected 20 member states. Unfortunately, only 15 member states able to attend. So we would like to focus on this 9 areas. I think governance of TNCM, healthcare facility offering TNCM services, TNCM practitioner density and distribution, availability of TNCM services, quality of TNCM, role of TNCM in public health initiative, best practices of TNCM. Then we will end with issue and challenges and way forward. So ladies and gentlemen, based on all these important areas, we have, engaged with the 15 member states. In fact, how is this methodologies have developed? First, we engage them through the inter-regional meeting, through the knowledge sharing. Then we gather the information, of course. After that, we also disseminate the field question. Field question means that we gather the info, fill up the questionnaire, send back to the focal point, and ask them to verify it. So, with that one, they will give us the feedback. Then, on top of that, we also do the desktop search. Okay, in order to have a wider or broader picture, so a more complete picture. So we have done the desktop search and we compile all the data, we analyze it. So these are the 15 member states participate in this. So as just now I have mentioned, we will focus on the 9 areas. First is the governance of TNCM in primary healthcare. So you can see that the full integrations country, there are 7 member state full integrations, if I'm right, and 8 are partial integrated, and 2 member states do not have integrations of TNCM in the primary healthcare. There are Brunei and Maldives. So, inclusions of TNCM in primary healthcare in their national healthcare services. From here, the data analysis show that 10 out of 15 countries have these inclusions. Then, as well as we also look into the budget allocations for TNCM, which is very, very important. Securing budget is important. So, how much is the budget? You can see that limited data for the budget allocations for TNCM. Like for example, China has spent about 4.14% of this in their TNCM for primary healthcare, 4.14 from the total health expenditures. Okay, Malaysia is just about 0.02%. So no data specific for budget allocation for TNCM in primary healthcare. So now, next come to the TNCM's on this healthcare facility and workforce in primary healthcare. So that's how we say that from this bar chart, you can see that majority of the member states have the center registry for their healthcare facility as well as TNCM practitioners. Then coexistence of the Western medicines and TNCM services in the same facility. There is also limited coexistence of the coexistence of the practice in the same facility. Now, come to the density and distributions of TNCM practitioners. From this bar chart, you can see that Bhutan has a highest density of the TNCM practitioner compared to thousands of populations. Bhutan is the happiest country. As this morning we was informed. Okay, so that, and limited data on the distributions between the urban and rural area and public and private sector for this, how you say, most of the member states. So now, how about TNCM services in primary healthcare? So that's, I can't see it. Sorry, already. Okay, so TNCM mortality offered in primary healthcare vary among the member states, including the unit mortality like traditional Thai medicine, Kempo medicine, Devahi Bear. This is, in fact, is malnourished medicines. They are malnourished traditional medicines, as well as common mortality such as Chinese medicine and traditional Indian medicines. Ladies and gentlemen, the TNCM coverage on primary healthcare services, in fact, you can see that TNCM, people go for TNCM services. So like for elderly health, pain management, rehabilitation care, wellness. So TNCM cover all these services. They also offer, can be complement or can be the first line treatment to the patients. So the reason for seeking the TNCM services in primary healthcare mainly is musculoskeletal disorder. So because due to the time constraint, I cannot really go into the detail one by one, but I'm willing to share this slide with every one of you all if you have the interest on it with the permissions from WHO. Okay, so the next one. Next one is on this quality of TNCM offers in the primary healthcare. From this slide, you can see that standard guideline for TNCM is important in order to have a standard practice, to have a quality practice, quality services. Like for example, clinical practice guideline, safe practice guideline, and facility standard guideline, and etc. So in order to have these standardizations, after the standardizations, we need to have monitoring and evaluations. How do you know that people follow the standard? How do you know that people, have done a good job by following the standards? So that is important to have a monitoring and evaluations. Like for example, adverse event reporting system for TNCM are available in most of the member states. Most of the evaluations through patient survey and monitoring of the key performance index. For example, Thailand, TNCM monitoring system cover the diagnosis, treatment, prescription, therapies, and health promotion. Whereas in Malaysia, we have a regular visits to TNCM practitioners to ensure compliance with qualifications and legal requirements. So, ladies and gentlemen, so this is a very complex, but it's in fact very simple. From the data analysis, we realize that a lot of best practices we can share with everyone, share with the member state, in order for them to have identify their best practices, or they can adapt and adopt. So, because during the data analysis, we categorize all of this under the 5 categories, under community engagement and health promotion, coordination and comprehensions, reaching and unreaching, as well as emergency response and treatment, research and development support. all of this, where do we get all this term? In fact, it's from the TM strategy, okay, from the WHO TM strategy, as well as for universal health coverage. So we compile all this info, and like for example, I just give you one example, like Bhutan, the first one. There is the integrations of traditional medicine unit into the primary healthcare for health promotion and elderly care. That's why we group them under the community engagement and health promotions. Okay, so next slide is the challenges and the key considerations. The challenges have been identified during this data analysis. We noted that there are lack of regulatory framework and enforcement for T&CM integrations, lack of standardized practice and evidence-based research to support T&CM integrations, limited human resources capacity and training in T&CM practices, and insufficient funding and limited intersectoral collaborations and communications. So we have proposed, okay, some of the method or some of the way to address it, address the challenges. Hopefully it can be addressed and solve it. So like for example, we address the lack of regulatory framework and enforcement for T&CM integration, like strengthening regulatory system and formulating supportive policy to enhance integrations of T&CM in primary healthcare, and so on. Okay, so then now I would like to come to my last slide. So this is the conclusion. The conclusions of this situation analysis in the selected country within the WHO, Southeast Asia and Western Pacific is, aim to achieve a successful integration, collaboration among government, policymakers, stakeholder is essential in overcoming challenging and creating an enabling environment for T&CM alongside the conventional medicines, guided by WHO recommendations and considering country-specific context. Thank you very much for your kind attention.
Thank you very much, Dr. Goh, for sharing with us the situations, traditional medicine modalities used, best practices and challenges of traditional and complementary medicine in primary health care in selected countries in the Southeast Asia and Western Pacific region of WHO through the situation analysis. Next, we move on to another type of methods that we use to collect country data, that is through survey. As many of you know that WHO is now conducting the third WHO Global Survey on traditional, complementary and integrative medicine to determine the latest situation of traditional, complementary, integrative medicine worldwide. Today we have two speakers from the WHO headquarters to inform us about this latest survey. First speaker is Dr. Rudy Eggers, Director of Integrated Health Services. He will give us background and methodology of this global survey. And the second is Dr. Kim Sang-chol, Unit Head of Traditional, Complementary and Integrative Medicine. He will show us some of the preliminary statistics of the survey the WHO has received from the member states so far. Now I invite Dr. Rudy Eggers and Dr. Kim, please.
Good afternoon and namaste everybody. Very good to be with you today. So as it's shown, I will be talking to you about the third global survey on traditional medicine. But before I go there, I'd actually like to talk to you a little bit about the WHO context and the background of how we work in WHO with traditional medicine. As was mentioned, I head the team of integrated health services, and what we think about day in, day out is really what and how healthcare is delivered and experienced. It really is about that encounter between the healthcare provider and the person receiving healthcare. And that's of course true, be that a nurse, be that a doctor, or indeed a traditional practitioner. We provide strategic and operative guidelines to countries, operational tools for them to work with on how to optimize health services being designed, delivered, and measured. Again, true also for traditional medicine. We have an integrator role, so we see ourselves, as is stated also in the name, as the group that is integrating services, that brings at that point of care where the person sits in front of that healthcare provider everything that is needed to that one spot. And of course, we adopt a holistic approach, which is theme of this conference. There are, of course, many parts of WHO that work with traditional medicine. You've already heard from Dr. Rudiger Krech about well-being and Dr. Reeder about science, and of course there's the medicines control or the medicines and regulations body. But really there are two foci of traditional medicine within WHO. There's the traditional medicine TCI unit, which is headed by Dr. Kim over here, and we provide the WHO core functions, things like norms and standards, partnerships and collaboration, country support, together with the regions, of course, and country offices and corporate functions. And of course, now in India, we've got the WHO Center for Traditional Medicine in Jamnagar, which is providing additional expanded functions to WHO on things like evidence and learning, data and analytics, sustainability and equity, and innovation and technology. Now, of course, this is the first traditional medicine summit that we are all attending, but as you saw in the slide or in the quiz previously, WHO has been on quite a journey already with traditional medicine. It started in 1976, as you can see on the slide, when the WHO Working Group for the Promotion and Development of Traditional Medicine was put in place. But then over the years, through the different primary healthcare conferences, Alma-Ata, Astana, different steps were taken to actually bring traditional medicine closer into the scientific sphere of WHO. Importantly, you can see on this slide also the events where we took surveys, and those are the red dots with the numbers. So the first one was in 2001, and then followed up with the other surveys. But you can see also that we don't actually have that much global data. It really is showing us that some of our data is more than 20 years old, and that obviously is not good enough to drive a program. So we decided to actually go into a new global survey, which this is now all about. Before we put together the survey, we actually went and reflected back on a more systematic review of what we know and what we need to know in traditional medicine globally. We created a structure of a global monitoring framework for TCI, and that's structured according to the system determinants, things like structures, governance and financing, inputs, physical infrastructure, practitioners, etc., but then also the service delivery components such as the processes, models of care, the outputs, and then finally the health objectives and outcomes. And we aligned it very carefully and made quite a big effort to make sure that we align this framework with previously established frameworks. And I want to highlight that first one there, the WHO PHC measurement framework and indicators, which has become the core document of measurement in the PHC space. Then, of course, we went to the global survey itself, and you can see the structure there. We created a questionnaire of 64 questions, so it is quite lengthy, but we do need good data. 28 of those questions were related to previous surveys, so that we can have time series of previous surveys. But we added 36 new questions, very importantly also looking at things like health promotion, health services packages, the health and well-being of indigenous people, quality assurance, reference laboratories, traditional knowledge, biodiversity, the reasons for seeking traditional medicine guidelines, patient safety reporting, and patient satisfaction. So all those questions were actually added. You can see the progress there, the timeline. We are now on 10th of August, so we've taken the first data out from this timeline, but we're actually continuing till November to collect further data. Very importantly, you can see the status there of where we are. And we have, at the moment, only 55 countries that have really reported out of the 194. So this is a great plea to you. If you are in a country, if you are in a position to report, please, please, please provide that information. It is absolutely critical that we update our global information on traditional medicine. As we did with the 10th of August deadline, we created a dashboard, and Dr. Kim will show you some data on that dashboard. But just to mention to you that that dashboard actually reflects not only the data of the current survey, of which we only have now 55 countries, but actually brings together the data and information across several of the previous surveys. So please do have a look at that dashboard. It is available in the exhibition area. You can play around it, look at the different regions and the different indicators, and get an idea of what information is there. Finally, the way forward, of course, is to get into a much more systematic collection and management of data, to integrate that data in routine health information systems. And this is across the world, not only in countries such as India, where some of that already is happening. To monitor the inputs and outputs, and then to measure the contribution of TCI in achieving UCI. With that, let me hand over back to the monitor. Thank you very much.
So, namaskar. Very good afternoon to all of you. So, it is my great honor to standing on this stage, because today I saw that many people are so enthusiasm on the traditional medicine, and then a lot of discussion on the evidence and data and integration, etc. So, as you know, that traditional medicine, everybody know that is a very diverse to country, or different name and different status. Some country formally trained more than 800,000 the traditional medicine practitioner, for example, in India. They have very qualified, formally trained traditional medicine practitioner. But at the same time, you can see all the Africa region and Latin America region, also traditional medicine still is quite informal status, so indigenous medicine, etc. So whatever, all this traditional medicine, they are all under the umbrella of traditional medicine, so it's important resources for us. So that's why I think with WHO, we're conducting this global survey. What is the status of the traditional medicine in policies, regulation, human resource, and product, etc. So I think that's why we're conducting. Of course, this data is not a full data. We just in the middle of the survey. So by the, as Dr. Rudij mentioned, by the 11th of August, we only got 54 member countries actually complete this survey. So I think this is some very preliminary data. So just to give you some apologies on this. So let us look at first, what is the policy on traditional medicine? So among those 157 respondents, actually 97 countries, almost 50% member country having said that their national policies. So what does it mean? Actually, it means that traditional medicine, the country, actually they recognize certain form of traditional medicine as a part of the healthcare, and they have a national policies and so on. So that's why this indicator is so important. Of course, that the product is one of the key main pillars that for the healthcare include together with the practice and practitioner. So we look at what is the whether country having mechanism for registration of traditional medicine, this product. So as you can see from this, actually the almost 123 country. More than 60% of the member country actually has the mechanism for registration of traditional medicine products. We also see that whether country have including traditional medicine products in their national essential drug list. And we found that almost 30 countries having traditional medicine in their national essential drug list. It means that traditional medicine is actually part of the primary health care for those countries. Of course, we also try to highlight what is the criteria their country applying for selecting those traditional medicine products as essential medicine. And also, we're trying to see whether traditional medicine is a part of the essential healthcare service. So as you can see from here, this is actually the only 53 countries actually responded. It's a new indicator we are trying to capture through this third global survey. And you see this around 30% of the member countries says, yes, they include traditional medicine is a part of the essential healthcare package. If you look at the whether country those essential service is still covered by the that health insurance scheme, so as you can see that out of 71 member states, is around 36 countries says yes, they are covered traditional medicine service under their national health insurance scheme. And also we realize that which traditional medicine modality is most common by the the health insurance. So I can see that acupuncture, that is the most common one, and then we also see that herbal medicine, and then the chiropractic and osteopathic treatment, etc. Also, that is the some order that's covered by the health insurance schemes. People are talking about research, evidence, and data. So we're trying to capture how many member countries having national research institution. So you can see from this slide that out of the 155 member countries, 66 countries say that they have a national research institution for traditional medicine. So what does it mean? Because we are all talking about where is the evidence of traditional medicine. I think what we realize that all this silo effort, but I think those research institutions is important resources. If we have a good partnerships and collaboration among all those research institutions, I think traditional medicine can make changes and make differences. We also the data, whether traditional medicine is a part of the routine information system. I think WHO, we're trying to build that capacity. That's why we built the ICD-11, including traditional medicine chapter. That's one of the purpose we're trying to build data for the traditional medicine. So even though it's a small number, 53 member countries, they are responded on this, around 40% that the member country says, yes, they include traditional medicine as a part of the routine health information system. Also human resource, as you can see from this, out of 131 member states, actually 36 countries say that they have a traditional medicine high-level, university-level training program for the traditional medicine. So means that traditional medicine is no longer the informal systems of medicine. It's actually some countries are very high level, very systemized, formal systems of healthcare. So that we have realized it. And also we see that many countries have been, continuing professional development program, including bachelor degrees, masters, and PhD degree, and so on. Of course, we also hold that, so where is the health and well-being of the indigenous people? So through this third global survey, we're trying to capture whether country having this national program for the health and well-being of the indigenous population. So out of those 53 respondents, actually we see that around 15 country member states, I think they say they have a program for the health and well-being of the indigenous people. They also they agree that they also recognize that the indigenous medicine as a part of the healthcare for those indigenous people has. So I think we're trying to capture on this aspect as well. We also try to see what is the most common health conditions being managed with the traditional medicine, because Dr. Goh Chong-sung also mentioned what is the most common element health condition, what is the strength of traditional medicine in managing this condition. So we're trying to see in the context of the OPD or inpatient setting, what is the common? As you can see that many of those lifestyle-led non-communicable diseases actually can be managed with the traditional medicine, of course, that including skin disease, cardiovascular, and many other conditions as well. We also trying to see what is the main reason people are looking for that traditional medicine. So as you can see that out of 48 member countries, 81%, they say, okay, they are using that traditional medicine for managing non-communicable disease. And also 69% member states say they are using for traditional medicine for health promotion as well as disease prevention. And also many countries also say traditional medicine has a great contribution for the palliative care and rehabilitative cares. So I think this is the message we're trying to bring. Traditional medicine, not only for non-communicable disease, but they also has huge potential for the health promotion and disease prevention, including palliative care and rehabilitative care and so on. So this is some summary that say that, I can say that around 100 member countries across the globe, they have the national policy regulation program for traditional medicine. And also traditional medicine already is a part of the essential medicine list and essential healthcare service for many countries. And also they are covered under health insurance schemes. Traditional medicine also as the part of the routine health information system, also many countries have research institutions. And also the traditional medicine already high level, university level, training program, including that continuous, professional development program as well. And also see that the traditional, many countries, certain countries having this program for the indigenous people's health and well-being. And also we can see that the traditional medicine not only helping lifestyle, non-communicable disease, but also they have a lot of, potential to improve health and well-being of the people. So I think this is a message. We cannot say all these 64 indicators, but I just to try time limitation, I just to capture some of the key information only here. Last message, again, in addition to Dr. Rudy said, I ask all the member countries, please participate in this global survey to raise your voice. So I think your voice can be reflected in our new upcoming global strategy. Thank you very much. Yeah.
Thank you very much, Dr. Ecker and Dr. Kim, for shedding the light on the importance and usefulness of the global survey to the development of traditional complementary and integrative medicine in the world. I hope that it would help stimulate the remaining member states that hasn't submitted the data yet to please send the survey result to Dr. Kim as soon as possible so that we can have the global report by 2024, and it would be the input for the formulation of the new strategy 2025 to 2034 in the future. Next in our agenda is the intervention session on best practice in traditional, complementary, and integrative medicine. Since traditional medicine in the world differs in principle and practices, therefore, it will be beneficial to learn about best practices of others as we may apply the approach to improve the traditional medicine service in our own country, and it might also promote the inter-regional cooperation. Today, we are pleased to have 4 key resource persons representing 1 selected country and 4 WHO regions to present their best practice and regional trends of TCIM in this intervention session. First, may I invite Dr. Asmanyani Benti Khalib, Deputy Director General of Health for Medical Program, Minister of Health, Malaysia, to talk about the art of traditional postnatal care and services in Malaysia as the first best practice. Thank you.
Hello. Okay, thank you, Madam Moderator. Malaysia is a multi-ethnic and multiracial country which is rich in diverse traditional and complementary medicine practices. Among the most commonly practiced across all the races is the traditional postnatal care, or TPC, which roots back to the Malay culture. The practice of TPC is normally passed down from generation to generation among families, either in verbal or written form. The postpartum period is critical as both mothers and child's well-being requires fervent care and attention to the provision of quality TPC services. Thus, the Ministry of Health Malaysia had incorporated TPC services into the primary healthcare system. TPC services are rich home services provided by practitioners who have been recruited by MOH under the MOH TPC program. They will undergo an orientation conducted by the State Health Department before being allowed to provide services to the postpartum mothers. The practitioners are introduced to the TPC services guideline for a better understanding of the common health issues that may be faced by mothers and newborn babies, as well as their roles and responsibilities as the TPC practitioners under the MOH TPC program. The TPC practitioners will provide services at clients' houses only after obtaining agreeable charges between both parties. Under the MOH TPC program, the provided services include traditional postnatal Malay massage, breast massage, hot compress, or we call in Malaysia bertungku, and body wrap or berbengkung or berbarut. We have continuous monitoring evaluation or M&E activities to ensure the services are delivered consistently and in line with established standards. This is also part of the safety and risk management to make sure the services are conducted safely and minimize the potential risks or adverse effects on the mother and infant. In addition, M&E also enable us to identify areas for improvement for the program. The introduction of quality TPC service at PHC level was welcomed by mothers as it is benefited them during their postpartum period. A local survey's outcomes showed that the mothers were satisfied with the postnatal care services under the MOH TPC program. Currently, the TPC service is provided in more than 100 government health clinics. For more information, you can visit the exhibition booth under the Western Pacific region. As the way forward, MOH Malaysia is dedicated to ensuring TPC services is readily available at more PHC facilities. MOH Malaysia is also committed to ensure the care provided for postnatal mothers via TPC services is safe, it is of good quality to enhance maternal and child health nationwide. Thank you so much.
Yeah, into the primary healthcare system is commendable indeed. For the interest of time, may I introduce next 4 intervening persons who will present regional trends on best practices of 4 regions of the WHO in the following order. First, Dr. Adi Al-Nusairas, Technical Officer from Access to Medicines and Health Technologies Unit of EMRO, WHO, to share with us the current regional trend in Eastern Mediterranean region of the WHO. Next would be Professor Dr. Elio Giovanni Rossi, Director of the Tuscan Center of Integrative Medicine, Organism of Clinical Governance of the region of Tuscany, Italy, to present best practices of European Union region. Third would be Mr. Felicissium Apollinari, Manager of Medicines Registration, Tanzania, Medicines and Medical Devices Authority, to present best practices of the African region. And fourth would be Dr. Jonas Gonzet Garcia, EMRO Traditional and Complementary Medicine Focal Point, will present best practice of Americas region.
Thank you, Madam. So I will present the status of traditional medicine in the region of Eastern Mediterranean. I assume that all of you knows about this region. This is the geographic area. It is from Pakistan in the east till Morocco in the west. So it includes 21 member states, including the Middle East and North Africa. The region has a high and rich history of traditional medicine, and esteemed physicians like Ibn Sina and Abu Bakr al-Razi in the 10th century, they have developed a unique system of thoughts and practice, and that all exists till now today. And they have synthesized the concept from ancient Greek, Roman, and Indo-Aryan civilization. The dominant traditional medicine system in our region is known as Islamic traditional medicine. Also, it's called the Yunani Tib or Tib al-Nabawi, which ranges from using herbal medications till phlebotomy. The traditional medicine is widely practiced in our region, and it is estimated that 90% of the population are using traditional medicine. However, in our region, that less than 50% of the country have a national policy for traditional medicine, have regulation and independent body to regulate traditional medicine practice. So even you will find that unregulated herbal products are available in the market, and direct to consumer advertisement taking place by different entities, by different like TV or anything. Although also some research activities have been successful, but there's a need to strengthen the research and to to focus on training and for traditional medicine by the government and academic institution. Usually the curriculum of undergraduate students for the pharmaceutical faculties focus on pharmacognosy and phytochemistry, and they give extensive teaching on it. But there's lacking of education of the traditional medicine practitioner. And for that reason, we need to strengthen the traditional medicine system in our region. For example, by November this year, we'll have a conference for the national regulatory authorities, and we called it Eastern Mediterranean Drug Regulatory Conference, or MDRAC, and the theme of this conference will be about the regulatory approach of traditional medicine in the region, and we will discuss the challenges that are facing our national regulatory authority regulating herbal medicine, and to have like action plan, how to strengthen the regulation, how to have harmonization and collaboration between the national regulatory authority. Also, we are working with the countries to support development of national policy, and even for the national medicine policy to incorporate traditional medicine within this national medicine policy. That's all from my side. Thank you.
Good afternoon. I am speaking on behalf of Eurocam, which is a civil society organization and network representing views and interests of European users and practitioners of traditional complementary integrative healthcare. It is a non-state actor by the WHO Regional Committee for Europe and one of the sponsoring organizations of the People's Declaration of TCIH and its coalition. TCIH situation in Europe. In total, 25.9% of the European population had used some form of TCIH during the last year, from 10% to almost 40% in Germany. Europe is the largest market for TCIH medicinal products, with an estimated value of around $33 billion in 2021. TCIH is used in 88% of member states of the European region, whereas only 20% of European countries have national TCIH policies. In Europe, we have great examples of meaningful integration of conventional medicine and TCIH, good research projects like on antibiotic resistance or integrative oncology, good research centers like Charité University of Berlin, University of Bern, University of Vienna, among others, and networks integrated with the public health system like Tuscany region and Baden-Württemberg. The region of Baden-Württemberg in Germany sponsors the competence network of integrative medicine, in which hospital, outpatient networks, and research institutes work together to develop, implement, and evaluate effective, safe, and high-quality integrative treatments. The region Tuscany in Italy, my region, has pursued the integration of TCIH in its public health care system over the past 25 years. A regional law became in 2013 the basis for the national law for TCIH for training and practice. Now in Tuscany there are 84 public TCIH outpatient clinics, 4 centers of reference, and 1 integrative medicine hospital. However, in many countries, mainstream initiatives and policies misinform about TCIH. Often the teaching, practice, and the access is actively discouraged by university and conventional health association. Additionally, the uneven availability of TCIH practitioner and medicinal products and the uneven reimbursement policies make very challenging to fulfill the patient right to choose the healthcare they desire. So, recommendation. Europe needs a radical acceleration of integration of TCIH alongside conventional medicine, particularly recognition of TCIH practice in all European countries, availability in public health care, easier registration path for medicinal products, higher public investment in research, equitable reimbursement policies for the patient. Thank you.
Thank you, Madam Chair. Thank you, Madam Chair. I'm privileged to present this talk on WHO Africa region. On focusing on the integration of the traditional and the complementary medicine in the health system of the country. This initiative was driven by the resolutions. There were 2 resolutions made by the WHO African member state. Resolution 1 of the 2000 and resolution 2 of the 2013, targeting promoting the traditional medicine in the health system and enhancing the role of these medicines in the health system. And the areas of integrations include, but not limited to, the health promotion, diseases, diagnostics and control, treatment, management, rehabilitation, and palliative care, targeting the primary health centers. So I just wanted to let you know that these initiatives were built in the health system in the 6 building blocks, which include the leadership and governance through the medical products and health technologies, the information and research, the health service delivery, health financing, and health workforce. So as you can see in the graph provided, during the implementation of these resolutions, there is a dramatic increase on the implementation. As you can see, there is a for the 2000 and for 2020. So you can see, for example, the number of countries which have the traditional medicine policies, legislation from the 8, from the 2000 to 40 In 2020, the same applies for the registered medicines and the medicines included in the essential medicine list, raised from 2000, which was 20, up to 95 during the 2020. Research institutions which are really responsible for the research and providing the data regarding the safety, the efficacy, and the safety of the medicines. Also, other research requests responsible for the compounding and standardization of the formulations, raised from the 18 countries to 34 countries in 2020. You can see the countries with the codes of ethics for practitioners. During the 2000, it was 0. None of the countries have these codes of ethics. But in 2020, they had around 20 countries have these codes of ethics for the practitioners. The same applies for the financing of the traditional medicines. It was 10 during the 2000 and raised to 27 during the 2020. Same applies to the curriculum, which included in the universities for the traditional medicines, raised up to 24 during the 2022. So there is a dramatic increase of the implementation of these traditional medicines in the healthcare system in those countries. So despite of this integration and successful we have seen in my presentation, there are some challenges which we embarked in during the implementation of these traditional medicines in the allopathic medicines systems. So there's a limited translation of political will into really concrete action, where you find that there is no really concrete action taken by the policymakers to integrate these medicines into the allopathic system. Inadequate information and limited data on research, which should be centered on the quality, of course, safety and quality of the traditional medicines, and limited recognition of the practitioners as an important health workforce, especially for the primary health care. And also we have limited policies on the conservation of medicinal products, medicinal plants, and protection of the intellectual property and the traditional medicine knowledge. And also there is inadequate inclusion of traditional medicines in the national health financing policies. At least departments, directorates, and units to coordinate the implementation of the traditional medicine policies for its integration into the national health systems, and also allocate adequate funds for the running of these policies and integrating these medicines in the national policies. Also, we urge the member states to build human resource capacity in traditional medicine and the primary care centers to support the professional developments of these practitioners. And the last but not least, these are the action points to WHO to continue to provide technical support and financial to the member states for the strengthening of the national capacity for research providers for traditional medicines and complementary medicines to complement each other in the provision of services for the benefit of the patients, to enhance the integration of this traditional medicine in the national health system, and provide guidance to higher organs of Ministry of Health to integrate traditional medicine in health center and health systems. And this is my end of my presentation. Thank you very much.
Show the slide. This one slide, if you can project it. Well, if not, esteemed colleagues, the role of traditional complementary and integrative medicine, TCM, across the Americas is both significant and evolving. In our region, American indigenous and American Afro-descendant traditional medicines coexist with those originating in other world regions, such as Ayurveda and traditional Chinese medicine, together with my biomedicine, configuring a therapeutic pluralism. This complex landscape and the need to transform health systems toward people and community-centeredness has triggered an imperative to better understand and articulate this pluralistic realm in a culturally sensitive yet safe and effective manner. Commitment to TCM integration is a top priority. 4 countries in our region, Ecuador, Bolivia, Mexico, and Venezuela, have enshrined it in their national constitutions, and many others have done so by passing national legislation, such as in Argentina, Chile, Colombia, Nicaragua, Panama, and Paraguay. Several countries are actively pursuing TCM integration initiatives. Brazil's advocacy at the World Health Assembly this year, facilitating the approval of the resolution on indigenous health, CAPSIN, the ObservaPICS, the National Observatory of Traditional, Integrative and Complementary Health Practices of the Oswaldo Cruz Foundation, and the Laboratory of Complementary and Integrative Health Practices, LAPACIS, at the State University of Campinas, all represented at this summit, are examples of the country's commitment to establishing a solid evidence supporting the country's policy initiatives. In nations like Bolivia, Guatemala, Nicaragua, Panama, and Ecuador, indigenous and Afro-descendant leaders advocate for and already implement substantial TCM initiatives with institutional backing and regulatory oversight. These initiatives are taking root within mainstream health systems. The US dedicates over $300 million annually to TCM research, primarily through the National Institutes of Health, including its National Center for Complementary and Integrative Health and the National Cancer Institute. The Academic Consortium for Integrative Medicine and Health and the Academy of Integrative Health and Medicine are instrumental in shaping TCM's trajectory in the country and beyond. The Department of Veterans Affairs Whole Health Program exemplifies contemporary advancement in integration and health system transformation, as shared today in the first plenary session. Venezuela has focused on training health personnel comprehensively, tailoring services to communities, and Mexico has made significant conceptual developments and contributions to the TCM landscape. In Argentina, significant academic activities in TCM are available. Chile's bottom-up approach, where initiatives begin at municipal levels and evolve into national policy, is noteworthy. Meanwhile, Cuba incorporates TCM across all healthcare levels. In Peru, the integration of TCM is particularly evident within Salud, their social security system. Notably, its complementary medicine division stands out as a WHO collaborating center on TCM. From a regional perspective, a significant achievement has been the establishment of the traditional complementary and integrative medicine network for the Americas, initiated in Nicaragua in 2017. It now encompasses more than 17 countries, and continues growing. A notable product of this network is the Virtual Health Library on TCIM, launched in 2018 in Brazil. This library, backed by the Latin American and Caribbean Center on Health Science Information, VIREME, of PAHO, offers an exhaustive regional insight. As discussed in the prior session today, it enhances access to scientific evidence and technical information, but it also provides information on regulations, policies, educational institutions, and health programs, and notably serves as a platform for experience exchange. To conclude, please visit our exhibit hall, where over 70 posters, 70, vividly detail our TCM journey across the Americas. Thank you. If we had the slide, there is a QR code where you can access all those posters and information.
Thank you for you all for sharing the best practice of each region, as well as the challenges and recommendations which would be useful for our forming of the declaration in the end. Ladies and gentlemen, we now come to the last part of our session. We are pleased and honored to welcome the Honorable State Minister of Indigenous Medicine of Sri Lanka to deliver concluding remarks, and also he would share with us the Sri Lankan long experience in recognizing and utilizing indigenous medical knowledge and resources for equitable health and well-being of the society in a sustainable manner. Please welcome Honorable State Minister Sisira Jayakodi, please.
All the excellencies and dignities of the session, Aiboan, Namaste, and good evening. As the State Minister of Indigenous Medicine, Ministry of Health of Sri Lanka, I express my heartfelt best wishes for the WHO First Global Summit of Traditional Medicine in Gandhinagar on behalf of Sri Lankan government. As a member of state, I have the honor to address this global summit forum. Firstly, thank you very much. All keynote speakers, WHO highlighted the importance of global survey, statistic, and regional trend of Eastern, European, African, American regions. I am happy to share Sri Lanka's long experience of traditional medicine knowledge and how to utilize traditional knowledge and resources for equitable health and well-being of the society in a sustainable manner. There have been numerous achievements in traditional skills and knowledge in health and well-being in ancient Sri Lanka. The historians claim that Sri Lanka is to be the first in the world to have established hospitals with the capability of performing surgeries of human and animals. The historical site, Mihintale, in Sri Lanka, still has ruins of the many believed to the first hospital in the world. Sri Lanka being country rich with biodiversity, cultural biodiversity, and diverse communities which were caused to well-developed traditional belief. Traditional medical knowledge and practices in the country. For example, our native doctors are able to identify any symptoms in human body only touching the pulse of the patient, and their predictions on the symptoms completely match with modern medical laboratory reports. Traditional knowledge in health and well-being providing healthcare guidance and treatment by using herbal, animal and mineral substances and certain other methods based on social, cultural and religious background. The knowledge of attitude and belief that are prevalent in the community regarding physical, mental and social well-being and causation of disease and disability. Most of illness cannot be only cured by drugs, but spiritual relief has to be restored to the patient for enhancing well-being of the patient. In this backdrop, meditation, yoga, panchakarma, musical therapy, exercises, and traditional food culture can play vital roles of this regard. By now, the world is asking for healing system destined with nature. In other words, essence of herbs. According to the WHO data, that 170 member states have acknowledged traditional and complementary medicine, which suggests that billions of people around the world depend on this kind of medical intervention. In Sri Lanka, people chose traditional Western or both remedies depending on their illness. In Sri Lanka, the use of traditional medicine also increased significantly at the peak of the COVID pandemic. For centuries, traditional medicine practitioners have used their traditional knowledge in conserving medicinal plant, environment, and cultural biodiversity. In order to maintain sustainability, there is a more traditional knowledge based on old leaf, manuscript, and ancient books on the traditional medical system. Still, this traditional knowledge is uncovered for public health development. During colonial era, traditional knowledge of most of countries which were on oral leaves and manuscripts had been taken by colonial supremacy. I would like to make a request proposed to World Health Organization to make necessary arrangement to bring back those ancient knowledge stored in museums and libraries in several development countries. The local wisdom of traditional medicine is available in every culture and every region around the world. These traditional medicine practices have been used for thousands of years and are increasingly globalized. Finally, I would like to propose the need to take the necessary action to build interdependencies between the sustainability of the environment and sustainability of the human species. Needful recognition and the development of new public health practices, which can increasingly translate into policies and action the recognition that the sustainable use of finite natural resources in a major department of health. Once again, thank you very much and wish you all the best.
Thank you very much, Honorable State Minister Sisirajaya Kodi, for your closing remark and recommendation. I would say that unfortunately, the time of our session is over and we might not have time. We don't have time to entertain the question from the floor. So if you have any question to address to any of the speakers, then you may do that later when they get down from the floor. Last, I have to thank all the speakers, wonderful speakers who give us all the information that we need today. Thank you very much for your participation and the valuable information. I have some announcement that I have to make. The Union Minister of Ayush, Government of India, will invite you all for cultural events, evening followed by dinner from 7:30 p.m. onwards tonight in Helipad Complex, Hall number 9, and transportation will be available for all. And for the next session, there would be plenary session 2A and 2B. 2A would be in this room. The topic would be on data and routine information system, and in Hall 3, The para session 2B will be on innovation, entrepreneurship, and equitable sharing of benefits. And it would start at 6 p.m. Ciao. Thank you. Pardon? Photo.
I remember feeling really afraid 2 years ago when I was gasping for breath, feeling like, I didn't know what was happening to my body and I was no longer in control. I consulted lots of allopaths, the family doctor, specialists, they ran a whole bunch of tests. They said that I was allergic, probably to dust, but that it couldn't be fixed. And so I decided to consult a homeopath. He told me to start yoga. I had to incorporate exercises for my lungs within everyday regular activities. I have young kids, so he said, blow balloons every day, that'll help strengthen your lungs. And with homeopathy, it's mind plus body. So you're playing a more active role. You're observing, you're making changes, you're reporting back, you're checking in. And particularly pranayam in yoga. And to make sure that it's something I did every day. Not just to strengthen my lungs, but also to de-stress. This entire journey with traditional medicine has made me realize that there is a very strong connection between our mind and body. You have a role to play in your own health. You can make choices that impact how your body reacts or responds or heals. A lot of it is in your hands, and I love that.
The most stressful part of what I do as an athlete is that first round jump when I'm at the top of the runway. Being based in the UK, being born and bred in Manchester, I have certainly been brought up with a very conventional mindset around medicine and healthcare. I'd literally had 2 years of incessant injury, 2 surgeries within the space of basically 12 months. And I'd had enough. I really wanted to seek out healing, and emotional, spiritual, mental healing. Some of the important practices that I do personally to focus on staying healthy would be making sure that I go out and do my meditative walks in the woods or in the forest, even in the park nearby to my home. I think it's important that we realise that conventional and traditional medicine can go hand in hand. Can't keep giving, and going hard 100% of the time, because ultimately you're going to burn out. After rhythm of rest, recovery, performance, that is part of my day, my week, my month, my year.
What has been for centuries the integral source of health for people and communities. What is still the first hope of God for millions of people worldwide for their health and well-being. Its traditional, ancestral, and indigenous knowledges of health and the world around us, constantly evolving, in balance with self, in harmony with nature. But how can we harness potential to help us address the health challenges of our busy lives? To turn the promise of health for all into a reality for all. To develop people-centered health services that are respectful of cultures and traditions. By sharing our knowledge and experiences of traditional practices, we can understand, acknowledge, and advance its role in building a fairer, safer, and healthier future. Respecting the wisdom of blending traditional and conventional, underpinned by robust evidence, innovation, new technologies, and sustainability. Imagine if we combine the best of modern and the best of the ancient to support harmony with self, societies, and nature. It can be done. Together, we can embrace the potential of traditional medicine and create a healthier, more sustainable, and balanced world. What has been for centuries the integral source of health for people and communities? What is still the first port of call for millions of people worldwide for their health and well-being? Its traditional, ancestral, and indigenous knowledges of health and the world around us, constantly evolving, in balance with self, in harmony with nature. But how can we harness its potential to help us address the health challenges of our busy lives? To turn the promise of health for all into a reality for all. To deliver people-centered health services that are respectful of cultures and traditions. By sharing our knowledge and experiences of traditional practices, we can understand, acknowledge, and advance its role in building a fairer, safer, and healthier future. Respecting the wisdom passed down from generations and embracing science, technology, and innovative thinking. Blending traditional and conventional, underpinned by robust evidence, innovation, new technologies, and sustainability. Imagine if we combine the best of the modern and the best of the ancient to support harmony with self, societies, and nature. It can be done. Together, we can embrace the potential of traditional medicine and create a healthier, more sustainable, and balanced world. What has been for centuries the integral source of health for people and communities? What is still the first port of call for millions of people worldwide for their health and well-being? Its traditional, ancestral, and indigenous knowledges of health and the world around us, constantly evolving, in balance with self, in harmony with nature. But how can we harness its potential to help us address the health challenges of our busy lives? To turn the promise of health for all into a reality for all. To deliver people-centered health services that are respectful of cultures and traditions. By sharing our knowledge and experiences of traditional practices, we can understand, acknowledge, and advance its role in building a fairer, safer, and healthier future. Respecting the wisdom passed down from generations and embracing science, technology, and innovative thinking. Blending traditional and conventional, underpinned by robust evidence, innovation, new technologies, and sustainability. Imagine if we combine the best of the modern and the best of the ancient to support harmony with self, societies, and nature. It can be done. Together, we can embrace the potential of traditional medicine and create a healthier, more sustainable and balanced world.
Our culture and our land are in our bones and in our blood.
Traditional medicine holds great potential.
Let's recognise that these are our inheritances for our future generations.
We are part of the solution, one that will benefit all human and planetary health.
It's very hard to be healthy on a land that's screaming out for help. Humanity cannot be well when we're not caring for what looks after us, and that's our planet Earth.
For Indigenous peoples globally, our concepts of health are holistic. Our health is also dependent on the health of our family, our community, and our land, so much so that it cannot be separated.
We kind of lost the connection we had with nature and with different ways to approach health. It's not like you have to choose medicine over natural ways of approaching health.
I think it's important that we redress the balance so that it's not all one thing or the other, but actually that we can find a beautiful middle ground.
Medicine comes from a culture, from a geography, from a place, from a people, from a need, from a climate.
Traditional medicine matter to the people of Africa because this is our culture, this is our future.
I think it's important that we realise that conventional and traditional medicine can go hand in hand.
Today there's more reliance on Western medicine, and what we do need to have a really strong forward-looking, progressive way of being able to recognise the medicines of millennia.
Que no se pierdan esos saberes propios, nuestros, que son tan sagrados, que son tan nuestros, que es la esencia de la vida del ser mismo, de estar conectados con la diversidad de pueblos, con la diversidad de nuestras semillas, con la diversidad de nuestras plantas, con la diversidad de nuestras aves.
Yoga is basically an ancient Indian practice. Yoga brings out the positivity from within, it improves our mental well-being, and it brings out the overall well-being of an individual.
TCIH is about more than just medicines. We need research on professions and practices more than just products.
We as Indigenous peoples know that our intimate and intricate understandings of our lands and our medicines have so much to offer everyone.
It's now time to recognise the opportunity that we have. It's time to turn on our ears, open our eyes, open our hearts, and understand where we need to go to together, collectively.
Traditional medicine matter to the people of Africa because this is our culture, this is our future. And for millennium, traditional medicine was used by our ancestors. Traditional medicine holds great potential, can play a pivotal role in advancing global health and well-being. Examples of traditional medicines from the African region include medicines for use for the treatment of communicable diseases such as HIV-related, and those for non-communicable diseases such as diabetes, hypertension, sickle cell disease. Even if medicines are derived from traditional practices and deemed to be natural, establishing their efficacy and safety through rigorous clinical trials is critical to guarantee that treatment is effective and safe. The practitioners are delivering safe services and quality services. It is important to integrate traditional medicine into health systems because of the benefits that this integration will bring about.
I remember feeling really afraid 2 years ago when I was gasping for breath, feeling like, I didn't know what was happening to my body and I was no longer in control. I consulted lots of allopaths, the family doctor, specialists, they ran a whole bunch of tests. They said that I was allergic, probably to dust, but that it couldn't be fixed. And so I decided to consult a homeopath. He told me to start yoga. I had to incorporate exercises for my lungs within everyday regular activities. I have young kids, so he said, blow balloons every day. That'll help strengthen your lungs. And with homeopathy, it's mind plus.
Keeping the feet 2 inches apart. You can see the demonstration also. Now join your palms in front of your chest. Interlock your fingers. Stretch your arms up. Now, while inhaling, try to raise your heels according to your body capacity. Don't force yourself. Just try to lift up. Exhale, bring your heels down. Relax your palms on your head. Inhale again, raise your arms up. Exhale, bend to your right side. Inhale, come back to the center. Exhale, bend to your left. Inhale, come back. Bring your arms down by the side and relax. Now again, raise your arms by the side. Keep your fingers on your respective shoulders. Join your elbows. Now rotate your elbows in clockwise direction for 3 rounds. Very nice. Now repeat the same in anti-clockwise direction. Everyone, yes, very good. Now slowly slide your palms behind your head. Try to keep the back straight and neck straight. I know it's a little difficult, but you are doing very beautifully. Now raise your arms up again and bring your arms down by the side. Now spread your legs shoulder width apart. Raise your arms in front of your chest, palms facing each other. While exhaling, twist your body to the right. Inhale, come back to the center. Exhale, twist your body to the left. Inhale, come back to the center and relax. Now sit comfortably on your chairs. Back straight. Now we will do pranayam. First, alternative nostril breathing. Make a fist with your right hand. Keeping the first 2 fingers bent, stretch your thumb out and straighten your ring and little finger. Yes, perfect. Now close your right nostril with your right thumb. Inhale from your left nostril. Close your left nostril. Exhale from the right. Inhale from the right again. And exhale from your left. This is 1 round. Repeat 2 more rounds. Try to keep your eyes closed and focus on your breath. After completing the round, bring your arms down on your knees and relax. Now, everyone, please close your eyes. Just listen my instructions carefully. Now we will try to make a humming bee sound. So inhale while exhaling. Make a humming bee sound. Again, inhale. Last round. Everyone inhale again. Keeping your eyes closed, we will meditate for a few seconds. Just focus your attention on your breath. Just try to observe how you are inhaling and exhaling right now. Now join your palms in front of your chest. Gently open up your eyes with a gentle smile on your face. Thank you so much. I hope you enjoy the session. Thank you.
Ladies and gentlemen, this is just a short announcement to let you know that the coaches to the dinner tonight will leave in front of the venue at 7:35 by the big blue arch where you landed this morning. And I would also ask you to please inform the help desk at your hotel of your return flights details, please, so we can organize transportation. Thank you very much.
So, dear colleagues, ladies and gentlemen, this session is about data and routine health information systems. I think we have seen in previous sessions the different ways of how to gather information about the use of traditional medicine, how to try to analyze existing documents about traditional medicine, evidence that is around, and we have seen that is well known to some of you, to others maybe less, that has been around for 150 years, and since 1948 it is maintained by the World Health Organization, and it deals with causes of death, but most prominently causes of illness, reasons for encounter of health system, and all kind of external causes that can influence your health, and has a lot of findings as well. The classification of diseases is an agreement between specialists, between country technical units. Some 99 countries participate actively in its maintenance. We have 20,000 people registered to comment on proposals for amendment of the classification. And if you think, is it significant? Maybe yes. We have 130 countries that report their causes of death with the ICD. We have 160 countries that do epidemiology, that manage their health resources or reimbursements. Why should we not also have in ICD a section on traditional medicine? So when ICD 11 was released and adopted by all member states for reporting nationally and internationally their health data, a module for traditional medicine was added. This module was focusing on traditional medicine that originates from ancient China as practiced in Korea and Japan, and we have started working since also on a module 2, that is a module that allows to compare diagnoses that come from Siddha, Ayurveda and Unani and some related medicines, so that we can create the evidence coming from the different sources. Now, it's not self-evident if you just have a common language that is independent of culture, that is independent of the language spoken somewhere, that you can collect the data. There is a system approach behind this. People need to be trained, information systems need there. And this is what we have here with the colleagues that graciously agreed to report a little bit their state of development in their part of the world, in their country, in their setting. The use is made, and you will see there is a broad range from those who are to this, using this in science. Others are starting implementation in routine information systems. Now, I'm aware that we are standing between you and a lovely evening organized by the Ministry of Ayush, but I think we will be concise and have wonderful presentations that hopefully will be invigorating as much as the yoga session that we just had. And with this, I would like to invite Dr. Goh, Ministry of Health from Malaysia, a traditional medicine director department, to talk a little bit about the need of standardized and integrated traditional medicine data in Malaysia's routine health information system. Dr. Goh, over to you.
Thank you, Dr. Robert. Is it possible to have the slide? My slide is not. Yes, thank you very much. Good evening, ladies and gentlemen. Hopefully everybody is fresh after the tea break. So, in fact, this evening I would like to share with you pertaining to the need for standardized and integrated traditional medicines data in the routine health information system, RHIS, in Malaysia. So, so to have a well-functioning RHIS is very important, because only a well-functioning health information system health information system to be managed well, and also help in manage the health manage the health system. Okay, so, and then another thing from this slide, you can see that there is an overview of the RHIS in Malaysia. So, in order to facilitate the integrations of traditional medicines data into the, national health system, it is important to have a good clinical documentations and good medical record keeping. So in the healthcare facility. So here SMRP in fact is a customer treatment information system. So it is in fact is the linkage between the healthcare facility and a data storage area. There is Malaysian Health Data Warehouse, my HDW. So it's very clear here. So through the SMRP, which is a linkage between the information system to gather the granular data and clinical information and store in this my HDW. So my next slide. So as of now, the T&CM data entries in the SMRP is limited to Ministry of Health hospitals with T&CM services, either by manual entry or export directly from hospital EMR to SMRP. The data compound is mainly used on counting T&CM services or encounter, for example, number of patients being treated with no diagnosis information capture. So now this slide shows the, the plan. We would like to have a nationwide reporting system for TM diagnosis using our SMRP. There is customer treatment information system. So from this slide, you can see that this is a roadmap. For your information, user requirement for SMRP, we already finalized. Now we are in the mid of finalize the training module for ICT 11 TM1. So would like to share a good news with you all. There is one of the Ministry of Health hospital, our TNCM unit has started to implement ICT 11 TM1. This is just a pilot project focusing on acupuncture services only. So hopefully, if the pilot project success, we will implement it nationwide. First is in the government's hospital, followed by private. Of course, private, we need to start with voluntary. If mandatory, we need an act to regulate it, to ensure the binding. So this is the screenshot of EMR in pilot project hospital, which I mentioned earlier, one of the MOH hospital, Ministry of Health hospital. The coding activity is facilitated by ICT 11 coding tool in English versions. Okay. So we have identified some use cases when we embark on the journey of implementations of ICT 11. So, but we would like to focus on clinical documentation and morbidity reporting. Ladies and gentlemen, during data analysis of the pilot project, we noticed a sole compilation on TM diagnosis provides limited information on how TM can contribute in disease management and prevention, especially if the national disease burden is classified and analyzed based on Western medicine's diagnosis. So we also realized standardized of TM diagnosis facilitate communications with Western medicine practitioners and promote mutual understanding, which is very, very important. My last slide is on challenges. In fact, this is not only challenges, this is also a success factor I would like to mention. This is based on this diagram, or this, chart is based on Leon et al. It designed in such a manner, it highlighted 3 factors: technical factor, organization factor, and behavior factor to, facilitate implementation of ICT 11. So TM1. So ladies and gentlemen, if government can provide the soft as well as a hardware to this implementation of ICT 11, it will be good. For example, training, secure the funding, okay, and resources, human resources, which is very important in implementing this ICT 11 TM1. So last but not the least is about the behavior factor. It is nothing new, but it's a human factor. So for example, TNCM practitioner, like TCM practitioner, Chinese medicine practitioner, they have complained. Coding activity is a tedious work, okay? It's time consuming. They rather spend time to see patients, okay, in order to do the coding. So that is the reason we must keep on motivate them. So we will have a continued engagement as well as awareness program in order to ensure the smooth implementations of ICT 11 TM1. So just to share with you all, we have collaborated with one local university to look into the knowledge, attitude, as well as the perceptions of the TCM practitioner pertaining to this implementation of ICT 11 TM1. Hopefully, the outcome of it we can share in our next meeting, conference or seminar or webinar. So I think that's all my presentation. Thank you very much for your kind attention.
Well, thank you, Dr. Go, and for showing how integration in an information system goes stepwise ahead. And I should have said that the coding with ICD-11 is no longer like in the past. People may know looking up things in a book, but it's more in a Google style. But still, it's an extra step that should be integrated in the information systems. Now we would go to Korea, to Dr. Han, to present the way this is collected in Korea. We have seen in an earlier session statistics that were showing the information about traditional medicine, and you may have seen on the side a small sign saying data based on ICD-11 coded. So it's already in large scale in use. And please, Dr. Go, tell us more about your way of doing. You are representing Statistical Office of Korea there. Thank you.
Thank you, Robert. Good evening, ladies and gentlemen. My name is Chang-Ho Han from Korea. My presentation topic is Korean experience. Before South Korea introduced ICD-based documentation of TM conditions, there were several challenges we faced. Without a unified coding system, the practice of TM has not been standardized. Without standardized coding, gathering data for research purpose was challenging. Without standardized code, it was challenging to create a reimbursement system for TM treatment. The absence of the TM specific code in ICD version used in Korea made it challenging to integrate KM with Western medicine practitioners in multidisciplinary healthcare settings. The main reasons for integrating TM specific code set in the Korean ICD version were enhancing patient safety, promotion of research, standardized and quality control, reimbursement clarity, recognition and legitimization, and enhancing global communication. South Korea's health insurance system is a public and single-payer system. The reimbursement is managed by the Korea Insurance Review and Assessment Service. The insurance scheme covers Western and traditional medicine conditions and treatment. The insurance claim is using ICD-10 Korean version to code Western medicine conditions and TM-specific conditions in and out patient setting. The TM-specific code set covers 151 traditional medicine conditions. As a healthcare provider, Western medicine and traditional medicine doctors submit their claims electronically, claim directly through HIRA's website. Furthermore, HIRA is conducting the quality assessment and evaluation of treatment, surgery, and use of pharmaceutical in terms of medical and pharmaceutical aspect and cost effectiveness. HIRA is also monitoring the drug and herbal extract administration and safety. ICD-coded health insurance claim data is used and linked to related system with generate national healthcare statistics and indicators of medical claim review and assessment. The integration of ICD-based documentation for TM in Korea has a profound implication for the nation's healthcare system, how it affects healthcare policy, resource allocation, and healthcare planning. The availability of standardized data on TM usage, effectiveness, and outcomes can inform policy decisions, providing policymakers with clear pictures of how, when, and why TM is used. When there are clear data on the prevalence and the distribution of TM treatment, it becomes easier to health authority to allocate the resources effectively. Development of TM in the country. The key benefit of ICD-coded TM data included standardization and consistency, enhancing research opportunity, better patient outcomes, legitimize of TM practitioner, economic benefit, and better integration with Western medicine. The experience from South Korea's integration of TM-specific code set into ICD provide valuable insight for other countries. Here are key recommendations for enhancing TM-specific clinical documentation practice and integrating it into a routine health information system with ICD-11 implementation. Engage all stakeholders, including TM practitioners, Western-trained clinicians, health IT professionals, policymakers, and patient group in discussion about the integration process. Invest in training program to familiarize medical coders and practitioners with the new TM codes in the ICD-11. Invest in health IT infrastructure, establish a continuous review and feedback mechanism, and promote research, implementation, audit, and quality control, engage in public awareness and advocacy, ensure the system retained a degree of flexibility to accommodate the regional or local variance in TM practice, and collaborate with the international organizations like the WHO and financial consideration. Thank you very much.
Thank you, Dr. Han, for this insight, how it works in a system where this is already fully integrated and covered by the health insurance. Certainly a motivation for all clinical staff to document well and accurately, because eventually the reimbursement is linked to the quality of the documentation. Now let's look at another case, I think, at the use in Japan. We will have Dr. Watanabe from Keio University and also the co-chair of the Traditional Medicine Reference Group that advises WHO in classification matters for traditional medicine, to tell us a little bit more. So please go ahead, Dr. Watanabe.
Thank you, Robert. It's a great honor for me to present in this great summit. I present about the change of the traditional medicine in Japan with the introduction of the WHO International Classification of Diseases TM chapter we call Module 1, TM1. So slide please.
It's the wrong slides.
Yeah, wrong slide.
Yeah, they will change it, they switch it, don't worry.
Would you like to? Okay, so next slide, please. Yeah, so I call pre-TM1 age. So traditional medicine has been practiced in all over the world. However, there are a lot of challenges to overcome. especially in Japan, so traditional medicine called Kampo medicine. So has a long history, and so Kampo drugs. So now, 148 are listed on the National Health Insurance Program, and over 90% of physicians that are allopathic medical doctors use Kampo drugs, but based on Western medicine diagnosis. So we have many challenges to overcome. TM healthcare reporting are not existed. And clinical research based on only Western medicine, and that TM diagnosis inter-rater diversity, and TM treatment inter-rater diversity. So TM terminology not standardized, and TM education system not standardized. So all 82 medical schools give the medical Kampo education, but not standardized. That's a big problem. So next slide, please. So we developed the browser-based platform to collect the symptoms, ICD-10 codes, that means a Western medicine diagnosis, and TM1 pattern diagnosis. Pattern is one of the TM1 module. Pattern diagnosis is very important. And then the Kampo treatment data. So through data mining, we have revealed the prediction of TM pattern diagnosis and the treatment analysis and the effectiveness of Kampo treatment and so on. So next slide, please. Yeah, so far we have collected over 12,000 patients' clinical data from 7 university Kampo units. So to decide the Kampo treatment, in addition to symptoms, Kampo pattern diagnosis is very important. But expert number is very limited. So almost all the physicians in Japan are no expert. For them, we analyze in many ways. This is the data showing the patient with coldness. So coldness is one of the common symptoms in Japan. And so we can classify it into 3 groups. One is the kidney Qi deficiency group, that the aged people with dry skin. And the other one is a blood stasis with dysmenorrhea, women. And the other one is a fluid disturbance with edema. So next slide, please. So next, we try to make a prediction of the pattern diagnosis because it's very difficult for non-expert allopathic physicians. Using decision tree, computer predict the TM pattern diagnosis, which Kampo experts give. So in this case, the correct answer is given by the expert diagnosis. So surprisingly, over 90%, accuracy, computer can predict the expert's diagnosis. Next slide, please. So next, we challenged the TM treatment for dysmenorrhea. Actually, the experts use many Kampo drugs, but we selected 2 representative Kampo drugs and how to distinguish 2 Kampo formula. And actually, the accuracy is not so high, 74%, but we plan to run a clinical trial using this system to distinguish 2 representative Kampo drugs from the dysmenorrhea patients, with the OBGYN non-expert doctors. So next slide, please. So this is the last slide. So I showed several examples using TM chapter of ICD-11. In Kampo medicine, TM pattern diagnosis is very important to decide that Kampo procedures And TM chapter module 1 covers the necessary Kampo patterns. So Kampo world has changed. So from chaos to cosmos using TM1 module of ICD-11. So which allows TM healthcare will be reported. TM clinical research will include TM diagnosis. TM diagnosis will be standardized, and also treatment will be standardized. TM terminology will be standardized, and TM education system will be standardized. Will means so we are still on the way, not completed. But I hope so soon TM2 module so will follow the TM1 change of the TM world. Thank you very much for your attention.
Well, thank you, Dr. Watanabe, for this wonderful example how standardized documentation can inform evidence for treatment approaches in traditional medicine. And now we're going to move on to Dr. Hughes of the Royal London Hospital, Director of the Department of Integrated Medicine. Please, Dr. Hughes, go ahead.
Afternoon, everybody. Yep, so I'm going to give you an overview of our experiences at the Royal London Hospital for Integrated Medicine in terms of implementing the new TM11 ICD codes. Okay, so just to give you a bit of background in terms of the hospital itself, the Royal London Hospital for Integrated Medicine is part of the National Health Service within the UK. All the clinics are led by statutory regulated health professionals, and the hospital runs on an outpatient basis only. So because it's part of the National Health Service, the hospital is only allowed to treat with acupuncture those conditions that are recommended within the NICE guidelines, the National Institute for Health and Care Excellence. So at the moment, our delivery of acupuncture is limited to tension-type headaches, migraines, and primary chronic pain conditions such as fibromyalgia. Now, because again, we're only allowed to employ statutory regulated health professionals, it means that most of the acupuncturists at the hospital are Western trained acupuncturists, although we do have a small number of traditional acupuncturists. So the hospital uses an electronic medical record system called EPIC. And within the EPIC electronic system, the acupuncturists are able to input a conventional ICD-10 diagnosis as well as a TM ICD-11 diagnosis. And in terms of the main barriers to the collection of this dual diagnosis, undoubtedly the main barrier is just the limited number of traditional acupuncturists that we have at the hospital. Now, we have been collecting dual diagnosis. I'm not sure if you'll be able to see the slide there, but you can see the Western diagnosis for migraine, tension-type headaches, and chronic widespread pain, and chronic primary musculoskeletal pain, and the corresponding TM ICD-11 diagnosis, which we're seeing in the patients coming through the hospital. In terms of the clinical documentation and whether it's enhancing patient care, yes, we're collecting data on this, and certainly at the moment it appears as though the patients perceive an enhancement to their care from obtaining a dual diagnosis from their treating acupuncturist. So the added diagnosis with the traditional medicine appears to be valued by patients. We are collecting data on this, but it is limited data at the moment. And certainly we see some benefits there going forward in terms of research. And certainly one of the things that we're interested in doing in the future is conducting some trials relating more to the TM-ICD-11 diagnosis rather than the conventional diagnosis. As I say, we've got limited number of traditional acupuncturists. So to try and increase that pool of data that's available to us, we are in discussions with the British Acupuncture Council in the UK, which is the largest professional acupuncturist, traditional acupuncturist body within the UK, and they've got roughly 2,500 traditional acupuncturists. So we're trying to identify some of the members who are already using the ICD-10 codes to see whether we can collect some data as well from private acupuncturists. Thank you.
So clinical routine use of ICD-11 traditional medicine to the benefit of health, and I think we will continue now finally with this first round to learn a little bit more about the state of development of the traditional medicine module 2, as I was mentioning, by Dr. Saket Trigula of the Ministry of Ayush of India. Thank you. Please go ahead, Saket.
Very good evening to all. I have two jobs to deliver here. One is to give a glimpse of what we are doing in terms of RHIS with respect to TM in India. That will be the first part. Second part, we will like to introduce what we have done for the development of TM Module 2 so far. I mean, we'll quickly run through the slides. So, Ministry of Health has envisaged one common pool of terminologies and morbidity codes in the year 2016. So, Honorable Prime Minister Narendra Modi ji has launched this in 2017. So, we call it Namaste Portal, National Ayush Morbidity and Standardized Terminologies Electronic Portal. So, the glad part is that just with this small initiative, we could actually support many other developments, and one of them is the standardized terminologies for Ayurveda, Siddha and Unani, which are already published. I think Dr. Geeta is around, I mean, who was steering it, and Mr. Kim and all. They were part of this big work. Dr. Ram sir is also here. I'm very happy to be amongst them. And next is the TM2 module development. And quite interestingly, India has, I think, Ayush it's an acronym, stands for Ayurveda, Yoga, Naturopathy, Siddha, Unani, and Homeopathy, and also Sova Rigpa. So it's not one traditional system. We are dealing with sort of diverse systems, and we are trying to bring them together. So this platform has actually taught us a lot, and we could also gain the confidence of WHO around 2018. We had done a pilot, and when they saw that these codes are usable in the clinical setup, sort of this confidence led us to the further developments. And so this is the value proposition of TM Module 2. I'm not reading this, but it's apparently the counting, comparability, digitalization, and better integration for various purposes like adverse reporting, insurance coverage, and reimbursement, and also global norms and standard developments. And aligning to that, we could do most of it, though it's hardly 5-6 years journey. I mean, we want to report that the reception is very encouraging, and the policymakers are like sort of appreciating these efforts. So this is helping us to steer things further. So this is a journey of ICD 11 module 2, and prior to that, the Namaste portal. Here, I just want to pause for a half a minute and just describe the complexity behind it. I mean, compared to the traditional Chinese medicine, where Japan, Korea, and mainland China, mostly the philosophical background is same. But in case of TM2, we are dealing with Ayurveda, Unani, and Siddha. They have their own identity and very, very, I mean, like sort of practiced very independently in India. But when we had to actually go on board with WHO, so we had only this space. And the magnanimity of our leadership and also the colleagues, we worked together, we saw the convergences, and we could bring the commonalities and also shortlist the around 300 plus conditions where we could sort of saw the possibility of the sort of creating a structure in align with ICD 11. So now you see this is the result of it. Now we are in the beta draft. So we have around 12 sort of sections in the morbidity section, and some subcategories, and around 6 patterns. And this is with all the mutual sort of coordination between all the 3 systems. That's a wonderful thing which we would like to bring to the floor. So this, if this is possible here, so rest of the traditional medicines also can sort of take a cue and start identifying the commonalities and bring them together for strengthening them. And finally, this is a snapshot of how case sheet is going to look. So we are going to prefer the double. Of course, this is for the testing purpose right now. But once we have this ICD-TM2 codes, preferably we will be recording the morbidity and also the pattern along with the Western medicine diagnosis, so that we can use this for multiple purposes. And also we can be compliant with the national system. So that's an advantage we are going to bank on. And finally, so this is our plan in India to use it at all the levels of healthcare with respect to TM in alignment with the Western medicine, which is already in practice at the primary, secondary, tertiary. And I'm happy to report that India has a wonderful system developed now that's called National Health Ayushman Bharat Digital Mission, where we have system agnostic systems in place. Now, National Health Authority has given us the platform, something called Ayushman Bharat Digital Health Account, ABHA ID. So where we can give the records to the patient, and that is system agnostic. They can have a homeopathy record, Ayurveda record, Siddha record, and this exchange, I think, brings in a lot of transparency and will reduce the redundancy part of it. So this is our plan, and finally, there are a few calls. So we want to share this happiness from India and the member countries who have participated in this TM2, that these are doable things, and these are also implementable. This is going to cover a major geographical area. We know this is going to be a big paradigm shift, because we have TM1 and TM2 covering almost more than 70% of the world where these systems are in practice. It's a big deal for us. So keeping in view of the same, our request from the WHO platform here is that please, if you already have a system in place, please implement them. And if you're planning, please go ahead, and if you are not having any specific traditional medicine, but somewhere if somebody is practicing, you can use this TM1 and TM2 so that you can have this count, and ultimately, if it is not counted, it is nowhere counted. With that note, I would like to thank you, the organizers, for this great opportunity, and my namaskar from India. Thank you so much. Namaste.
Yeah, thank you, Dr. Chigula, for this overview on the state of development in India, and also for this module 2. We will now have a few brief interventions, brief comments on the reflections of status and prospects for standardized and integrated documentation of traditional medicine conditions coming from different places. And we would start with Dr. Zagran from Iran, please.
Dear ladies and gentlemen, good afternoon, and greetings from Iran, and thanks to the organizers of this great event in this great historical and cultural place. There is no doubt that implementation of traditional medicine modules and chapter of ICD-11 in RHIS helps to facilitate and improve integration of traditional medicine services and systems into healthcare systems of the countries. It can clarify the strength and weak points of the traditional medicine systems and issues according to the statistical data. Therefore, it can make an opportunity for the policymakers, for governments, for institutions, for individuals, researchers, and etc. To know about the opportunities and face to opportunities of traditional medicine based on a clarified overview for different purposes, like for education, for research, roadmap, budget, for insurance coverage, for policy making, and other purposes like them in different levels, like for researchers as individuals, for institutions, for even national levels, and even for global strategies and international cooperations. Therefore, this implementation can be useful for traditional medicine integration into healthcare system all around the world. But in Iran, that is a big country with more than 80 million population in Middle East, We have an advanced RHIS infrastructures and basements for allopathic medicine. But for traditional medicine, although traditional medicine system in Iran that we call it Persian medicine, that it is one of the oldest traditional systems of medicine dating back to 1,000 years ago, is completely regulated and legalized in Iran, and also some other traditional systems of medicine like Chinese medicine, like homeopathy, like naturopathy and others. Although they are completely regulated and legalized by the government of Iran and Ministry of Health of Iran supports these traditional systems of medicine, unfortunately, we have not a centralized and integrated documentation and coding system for traditional medicine classification. Therefore, this traditional medicine module, module 2 in ICD 11 makes an opportunity for us to review this the local documentation system that used regionally or even institutionally, to merge them together and with the panelists and specialists in the field to make an